Yes.
And Wayne.
Yes.
17. Opposed? 0. Not voting? 2.
I just have one more thing. Lisa left, but maybe Pam can answer it for me or secretary. But I have a community member who is running in the Chicago Half Marathon, and he put in a donation request. So he's kind of needs to leave tomorrow. So I was just wondering if you guys got that request or not. I just know his nickname, but Daryl. Is it Daryl? Yeah, I'm saying. Yeah.
Yeah, it's on the clipboard. She's gonna be bringing it in.
Okay. Thanks.
What was it for, Ray?
He's running in a half marathon in Chicago. He got invited to run. So, but he asked for a council donation to help with travel expenses, but he was just inquiring about it. So,
Okay, are we ready to move along here? We have the Indian Health Service here have graced us with their presence today. Come on up. How are you?
Thank you. Thank you for having me. It's an honor to be here. That's yes.
I'll give you the floor.
Okay.
And we'll
Thank you.
probably have some questions for you.
Absolutely. So thank you. Good morning. It's good to see everyone again. It's been a little while, so I provided a couple reports. I know that you met with Francine the last time I was out on leave, and she has provided a document for you on some of your follow-up questions for her. There was follow-up questions about the emergency department and their staffing, also with the dental department and their hours of operation. And she's provided a really good summary for you just on those areas. She also gave a little bit of data about the dental department and what our flow looks like, how many walk-ins we have, how many appointments we have. There was also a question about the outpatient department and the Boston provider contract. And that contract has been extended through June of next year. So services are continuing. We still have our partnership with them. We're very pleased about that. She also provided a summary of the hospital complaint and the grievance process for you. That's summarized on the back. But basically at any point of contact within the hospital, any patient, we welcome them to bring their concerns to us. They are usually elevated at the department level. We have a hospital liaison who also takes complaints, and any of the leadership team, we're all on standby. We take any concerns, any issues at any time. There was also a question about the SART, the Sexual Assault Response Team, about the meetings. They do occur on a regular basis. We currently have 4 nurses that are trained, and they serve on an on-call basis, just throughout the month, just trying to stagger those, so that we're not calling on the same nurse at the entire time. I know that we are making space upstairs for the white buffalo calf advocate to be up there on a consistent basis. So we're pretty excited about that. That has always been a good partnership with us. And she also shared with you that we currently do not have SANE exams for pediatrics in-house, and those patients are referred to Pierre. So if you have any questions about that, any of that information shared with you, please reference that document. And of course, you have my contact information. Contact me at any time.
Steve, you have a question or a thought?
Good morning, council and administration. Thank you for coming.
I guess one of the reasons why we asked you to come is because we're getting a lot of complaints on fake tests. I'd like to cut through the chase and address, some of them.
Sure.
I know you just said that, you have open communication and there's a process for complaints. And, but from what I've heard and from what I've experienced, that is not the case. I noticed that there is a form, or there used to be a form that was available there that you filled out, but that doesn't do much good if that form, there's no response to it. If the individual who's making the complaint doesn't get a response. The other thing is the type of treatment from some of IHS staff that's given to our people, the way our people are treated. I've experienced that myself. I've sat there and I've watched mistreatment or no treatment, period. And so those are some of the issues that our people are complaining about, that I've experienced personally. And our people deserve the very best possible medical care, health care that you can provide. It's in the treaties, and it's also a right for people to have good health care and access to that health care. Now, those are some of the issues that we need to address. What is being done? I know this has come up over and over again for years. I started in the health field back in 1989. And I've been hearing the same reports over and over again. And yet, from 1989 to now, our health care is the worst I've ever seen it. Right here at our own Rosebud IHS, the worst. And during that time, I had the opportunity to sit in on many of the IHS meetings. I've had the opportunity to meet with some of the staff from the Aberdeen area. And over again, they told us all these great things that was going to happen. And to this day, they've never happened. It's never been done. And every time we meet with IHS staff, it's the same old story over and over again, the same old song and dance. And yet, our healthcare seems to be going backwards. We're not making any advantages. I'd like to also ask, how many providers do we have at IHS right now?
So, and I have provided you with a sheet.
Yeah, I'm asking you. I'm hoping you know right off the top of your head.
We have, in our outpatient clinic, we have generally about anywhere between 5 and 6 providers. That's what we should be scheduled for throughout the day.
And I'm talking about right now.
That,
Yeah,
so
I heard just the other day, the reason why I'm asking, I heard just the other day that so-and-so couldn't be seen because there was only one provider.
and you are correct. You are correct. And that was a fluke. We had one of the providers that was scheduled for that day had a death in the family and had to be called away. And there was another provider that was sick that day, and it just left a hole. So there was one day where we were really short. To help out with patients, our leadership team went, one of them is a nurse practitioner. So we worked with patient registration to help cover things like prescription refills and things like that. But you're absolutely correct. That is not, it was not good. I've asked our medical director to put together a plan, and I've provided you a copy of that plan going forward. It was just unfortunate.
Yeah. Well, that's like, like I said before, it's another plan. It's another way of saying you're going to move forward. But like I said, dealing with IHS all these years, I haven't seen it yet. And so hopefully you'll address some of these issues and get serious about it, because it's just ongoing. I've seen it myself. I've seen the mistreatment of patients myself. And I personally witnessed that. And I don't think it's professional for your staff to mistreat our members. And I also think it's your duty and your staff's duty, whoever's in charge, to make all the corrections and make them immediately. Our people deserve better treatment, the best treatment we can possibly give them. And instead of sitting here and telling us the same old story that we've been hearing for years, let's see some action. Let's see some changes actually happening. Otherwise, we're going to be sitting here next 2, 3, 4, 5 years hearing the same old story and nothing's still being done. So that's why I originally requested our Attorney General to be here to sit down on this. Because if you recall, we won a lawsuit against ITES. And ever since then, there has been no changes. Nothing that I can see. And from what people are telling me, it's actually getting worse. So thank you for your time. Thank you for hearing me out. Hopefully, we're going to see some action in the near future. Thank you very much. Bye.
Pam.
Good morning, Melody. Thank you for coming. Questions that I have are booster vaccines. I heard they're on hold. Are they on hold?
We just received notification today. We just received an update. I have not even had a chance to look at that email yet. But as soon as it is, and we solidify our processes to give this booster, we will. I know that we have ordered we've ordered the booster, and I think we just got a shipment today. It was either today or yesterday.
Okay. And then he kind of touched base on the care providers that we have there. How many do we have total?
Today, I don't have the exact staffing level in front of me for today, but because we had two providers that called off today as well. But I know that we've got normally we would have a pediatrician as well as 3 other mid-level providers, and a full-time internal medicine doctor. That's our MGH doctor that's downstairs. And usually we try to get our hospitalist rotation, who is also internal medicine, who is scheduled in the outpatient in the afternoon.
Okay. So I guess what I'm getting at is I do know that we had several calls regarding people able to make appointments for this month, and they were already full. There was a day where your guys' computer system went down. What types of process or procedure do you guys have to take care of them sorts of situations? Because like for the month of September, you guys were full on your appointments. Now, let's say someone needed a pill refill, but they can't get that refill unless they see a doctor. So how does that work when your schedule is full and their pills or medication is out? What's the procedure for that?
So our medical director team, we've got a acting deputy clinical director and also an acting medical director. The deputy clinical director is a nurse practitioner, and she is on standby on a consistent basis, and was during this significant staffing shortage to be able to fill those prescriptions. And our pharmacy they're also able to give a bridge order in those instances.
So this person that is on staff to do those types of things, how is a patient to know, how are you guys letting patients know that if this type of situation should occur, that you guys have that person on staff? What's the phone number, and how do they get in to see that person to get a refill?
So both of our frontline staff, the patient registration has that information, as well as our pharmacy staff.
So they're supposed to be the ones to give that information. So if I called, I need a refill, but I'm not telling the registration department that I'm calling for a refill. I call and say I need an appointment, and they're telling me that you guys are booked up for the month. I guess how is there another question that maybe they could ask or something so that they know specifically what the appointment is for? I mean, because a lot of people don't disclose that they're calling for a refill. Do you know what I mean?
And it does, and many patients are private, and they don't want to share the purpose of the visit, and I totally understand that. To me, it sounds like a little bit of patient education, and we can certainly do that. All of our providers can tell our patients, when you need a refill and you can't get in to see us, this is what you need to do. We can educate them.
Yes, I think that needs to happen. Also, how are we doing with, okay, this is September month's fluke of the, no appointments available. What is are you guys keeping a procedure if anything like this should happen again, or,
I'll have to check on the flu vaccine.
I guess, the mess up, or however you would say it. How are you guys finding a procedure to correct that? Meaning these appointments that people can't get because you guys were short on staff.
Yes. What I instructed the patient registration staff to do is if we have a patient that calls in and they're not able to get an appointment, they should be taking the name and phone number of that individual. And as soon as the schedule opens back up again, we need to reach out and contact that individual. And I've asked that those individuals be first in on when we have the open appointments.
Okay, so I'm gonna change subject and go into mental health care. What is IHS doing as far as creating mental health care for our people?
We have a couple different, of course, we have our behavioral health staff, and patients can get access to appointments, come in, walk-in appointments through behavioral health. We also offer telebehavioral health at the point of care in the emergency room. For example, if we have a patient that comes in and they have a behavioral health need, it's urgent. We have somebody that has suicidal ideation or another emergent behavioral health need. We've just opened up psychiatry services through the emergency room through telehealth, so they can get their assessment done by a psychiatrist with telehealth, and they also help out with medication management. We also offer those same level of services on an outpatient basis. I've been working with with corrections and also with our telebehavioral health to try to open up telebehavioral health in the corrections, both in the adult and the juvenile corrections areas. So we're working on a process on that. Ideally, the inmates will, to us, they're patients, but they're an inmate. Ideally, the individual will not have to come into the hospital if we can get the telebehavioral health to them there at where they are in a safe environment.
Okay, and then my last question is, who does family contact when someone is at end of life and wanting to come home, but yet they still need that care, and we need a bed available at the hospital for that person. What's the process, and who do they talk to, and how does that work?
We have an on-site nurse case manager who specifically does that, so they can just,
Who
call.
is that?
Her name is just right at the tip of my tongue. I'll come back to that though. But even if they just call and ask for nurse case management, they will, they'll be put through. Christine is our nurse case manager. And so this happens, unfortunately, it's happened, even this week. We just had an end of life that was up on inpatient. I think we lost her. It was either Monday or Tuesday. But we do that, we will case manage the entire process. And if the nurse case manager is not available, our DON and the assistant ADON also can step in and do case management, because we'll work with the hospital directly and also with transportation and trying to get, for example, if the patient is in Rapid City and wants to come home, and the family would prefer that the patient come to the hospital so that we can take care of them. We can provide that end of life care. And we do everything that we can do to accommodate that patient.
So can you maybe create some kind of reading material or a PSA or something regarding all of this and putting it out there? Because with all that's happened in the month of September, these types of questions are being asked because there's nobody at the hospital answering their phone, as in returning the phone call. There's been a lot of questions on these boosters, and you say that you just got the email, you're gonna read it whenever you get back, but there are people that have said they went up to get their booster shot and were told that they're not going, or you guys weren't giving it because you guys were waiting for the one that's coming for monkeypox, I think it is, that's coming. I don't know which vaccine is coming, but that was the reason why you guys weren't doing any of that. And then I had asked on the J&J booster, and I was told that you guys don't do a booster for J&J.
We will get some PSAs out there on all of the boosters so that there's not any questions. I know that we just received the guidance from headquarters about this most recent booster. And so we're in the process. We've got to put standing orders out there. We've also got to make sure that we've got our supplies, and like I mentioned, I think we just got the boosters. But we will get some PSAs out there. Yes.
Okay, so what is going on with the J&J? I mean, does
I will have to
J&J
check.
allow for boosters?
I will have to check. And I'll make sure that's in the fact sheet as well. I don't want to misspeak. I'm not a nurse.
Okay, all right, thank you.
Sure. I have Lisa, then Cheryl.
Good morning, and thank you for coming down.
Jordan.
I would like to thank IHS and their nurses for when we have our tribal members who are in other facilities, and they work hard to bring our members home for comfort care here at the hospital. And I think they really make a good effort in doing that. So I would like to give them a big thanks for that and your efforts as a hospital to doing that. I know there was a position up there that was recently vacated. I don't want to mention names, but it was the compliance. Is that what it was? Compliance care. Since that position has been vacated, has anybody filled that position?
No, that individual is still on paperwork. It's still assigned to Rosebud, but that individual is detailed somewhere else. So what we have done in the interim is we've got support from actually area leadership has provided us with an acting quality manager who was here from another service unit. So she has rolled up her sleeves and is really helping us with quality, which is really important right now. We're right on the verge of a Joint Commission accreditation.
Okay. And I was just wondering, because I know the facility in itself has not been well maintained. I was up there about a month and a half ago in the emergency room, and the bathroom was overflowing. There's urine on the seats, and I've seen pictures and I actually seen it myself of like blood splatters on the curtains and the floor. And when I had addressed that issue with some employees up there, I was informed that since that person has been detailed somewhere else, that there was nobody there to make sure that any of that was in compliance. So I don't know if the maintenance workers are supervised under that person, or if they go out regularly and make sure that things are cleaned up and taken care of within the facility. So that's just been a major complaint that I've gotten from concerned tribal members. And I'd like to address that issue just for the upkeep of the facility up there with.
Absolutely. And, you know, those issues were reported up through, of course, they made it through to me. We recently hired a new housekeeping supervisor, and a walkthrough a month ago of the ER, actually by area leadership, just really commented on how clean it was, the entire facility. So we heard, I'm not happy that it was found in that condition, that those things are reported, because as stated, we should be really taking care of our patients. That is our job. That is our responsibility. They should be receiving courtesy, dignity, and respect on every point that they come into the facility. And our facility should be clean, and they should be receiving the best quality care that we can provide.
Yeah, I know when I was in there about a month and a half ago, and there was some, it sounded like a nuclear alarm going off in the ER, and you have sick patients in there that don't want to be hearing that going off, and it was going off for probably about 2 hours, and I wasn't sick, but I had a family member that was sick, and I was thinking, when you're sick, you don't want to have to hear something like that, and it just, I think it would just make them feel worse. But and you're right, we don't want to interfere with patient care at all in regards to scheduling appointments or making sure the facility is upkept. And with that, is there like maybe a way that IHS can schedule appointments like once a week? Because I get complaints that they're told to call in one day, like the first day of the month, and there's no answer. And by the time they finally get through, then all the appointments are already taken up. And that just concerns me, because you have diabetic appointments, but diabetic patients that need to get their refills, and not only diabetic patients, but other patients. But if IHS can at least schedule, kind of have a staggered time, maybe 2 or 3 days out of the week, just to schedule appointments during that time, because I think it's, it's disheartening for our patients who need to refill their meds, and it's already booked up by the time they get through. And also, can you give us some, a little insight on your work with the Boston doctors, how often they rotate out, and are they considered part of IHS providers? Or does IHS have their own providers aside from when the Boston doctors come in?
So the Boston doctors, and I did provide you a copy of the schedule, but the Boston doctors are here on a consistent basis. It may not be the same doctor, but the schedule we do try to keep consistent.
And are they considered part of IHS providers, or does IHS have their own providers besides the Boston doctors?
Both. We have a combination of both.
Okay. Yeah, because I get a lot of calls too where patients would refer the Boston doctors, and sometimes they're not. And I know we've done their MOU here through the council, and I don't think that's something that can be helped if they're rotating out. But it was just, I don't know if that information's out there, that they are on a rotation and they're not here consistently, but a couple months or so. And is it just for the clinic wise, or do the Boston doctors also provide like ophthalmology or dentistry?
Right now, it is strictly hospitalist care and primary care.
I have Cher and then Jordan. And
Thank you for being here today.
My first question that I have has to do with Indian preference. Are you guys Indian preference at IHS? Okay, does that go for promotions as well?
Promotions are individual performance based.
Okay.
I know that we have a lot of our own people that work there, that care about our people and have been there for a long time. And I never see them move up the ladder. And they're good workers. They're helpful. They make you feel comfortable when you're there. They take good care of you. You know you're in good hands. And I never see them climb up the ladder. And I don't think that they're getting the opportunities that other people are, that non-members are getting. I wanted to address that issue. I don't want to name any specific people, but there are a handful of them there in a lot of the different departments, not just one specific department. I wanted to address the cleanliness of IHS. I did see some of the same things that Lisa was talking about. I would like to see a cleaning schedule. I mean, regardless of, patients getting cared for, we know, we all go to that hospital. So you sit in those rooms for a long time. You sit in the back, even when you get pulled into, the emergency room because, well, it's an emergency room and that's how the preference goes based on triage. So I think that it would be nice to not just have somebody come through picking up the trash, but making sure that those blood droplets aren't on the floor. I have some pictures here that I'll show you after we finish of like the walls and one of the vents upstairs in one of the rooms that's very rusty. The rust is like down on the floor and it looks like it's an intake vent and it's full of dirt and it's really disgusting looking and it's pulling in air and pushing it out. So it's just a concern for me there. Also, the process for appointments is an issue. Calling at 8 a.m. and like bombarding the receptionists and the ladies there, that's really tough to do. And showing up at dental at 7 a.m. when the doors aren't even open and waiting to be seen, it's really a big issue. I feel like we could do a little bit better there, try something different for scheduling appointments. Maybe it was the best, like it'd be good to consult with the ladies there that answer the phones. Maybe they could give some good insight on what issues that they face when those 8 a.m. calls, because I've done it. I mean, you have to call and call and call and call, and once they answer, I mean, it's tough. And I don't like our people having to go through that. And I guess finally, since we don't have so many providers, what are we doing as far as recruitment? Or even like back in the like 90s, I remember we had a CEO. She's long past, took her journey like maybe 10 years ago, but she her name was Gayla Twiss, and when she worked there, we had all different kinds of people coming in. She had all different kinds of contracts. She'd do, the Army would come in, do dental work. They would have just different people from different hospitals constantly coming in. She would also do this thing where people could come volunteer how they do in different countries. They would do a recruitment and bring doctors from Rochester and throughout the whole nation to come here and volunteer for a week. I think if we start doing some things like that, it could really alleviate some of the stress on our two practicing physicians that we have here. But is there anything else that we're doing as far as recruitment?
Right now, we've got the area medical recruiter who works closely with some of the schools. We do a lot of our outreach is by somebody who knows somebody, and absolutely, we do need to step it up. I think, we're transitioning out of the COVID mode, and we do need to step it up in the recruitment piece. I agree with you.
Yeah, I know we have a school, SGU here, our university, and it has a very excellent nursing, school of nursing. I think it would be really good to start reaching out to them and seeing if they have anybody that's about to graduate and start bringing them on.
And with that, and I don't mean to interrupt you, but Callie is doing that. She's working already with them directly, you know, and we work to have the student nurses come here, hopefully, you know, open the eyes of some young people to get them to get interested in the medical and the nursing field. You may recall, you know, we've had our events that we've had annually where we do try to work with the schools. Last year, we worked with the middle school. We set up and we had a career fair, and we had all the disciplines were represented, hopefully to again, just recruit for young people to come back, get trained, work in their community.
That's great.
Yes.
That's great. Then the last question I have, sorry, everybody, I know we're all taking like forever because we all have a ton of questions, but if you were able to set the amount of your budget, what would be your ideal number? What are your shortfalls and what areas?
That's a really, really good question, and I certainly do appreciate it. You know, I think that right now, you know, just looking at it, it would be good for Indian Health Service if we were to be 100% funded rather than 55% funded.
Thank you. Oh, also, I want to compliment the nurses just the same as Lisa did. I really appreciate the good work that they're doing to bring our people home here for comfort care. Thank you.
Thank you for coming, Melody. I just have a question back on mental health. So do you have any counselors available in person, or are they all on telehealth?
We do.
Okay, because I got a couple complaints, and I guess it's just disheartening because I know a lot of our young people and our older people kind of go through depressions and stuff. And if I had to go in there and talk to somebody on a screen, it's not going to do me much good, right? Like as a person, we're more of a physical, right? So you being there and being able to talk to you is different than talking to them on the computer. So is that just in certain cases then that they're on telehealth, or?
We absolutely, you know, we've been 100% staffed up until the past month.
Okay.
With behavioral health. So, and then and now in office appointments are available.
Okay, I was just making sure that way then they have that capability to do that, because I don't want them to have it be harder on them if they're not being in person. Okay.
Absolutely.
Thank you.
I have Martha.
Good
Ray.
morning, Melody. Good to see you here. Couple of concerns. Your housekeeping. I was there a couple weeks ago, and there was actually a cockroach coming down from the ceiling, just cruising around on the wall. And I told the nurse that was talking to us, I told her, and she just laughed me off. I was kind of disappointed, so I knocked the cockroach off and I stepped on it. And the patient that was there with me, she said, "Ooh, do we have to come back to this place again?" So apparently we have to, because that's our only place that we go. I think the lady should have went and got somebody from housekeeping staff and actually wiped the wall down or sprayed it or something, or got us out of that room, because I was very disappointed. Maybe there was more. It was a big cockroach, and I'm sure it hatched along the way somewhere. My second complaint is dental. It's really hard to get in there. You gotta stand in line at 7 o'clock, but where do we go? The doors aren't open. So we really need to get those doors open by 7 o'clock so we can get in. what's gonna happen when this winter comes? I still can't get into dental because of, I have to wait. And the other complaint I have is you refer patients out. They come back and they need to go to another provider. Well, you come back and you tell, the person that referred you out, you come back and tell them. And they said, we don't work with this company, or we don't work with them, so we can't send you there. And my last complaint is, you really need somebody there that speaks Lakota. Lakota wagalagacha. Wana hina patience hina khapchang. Ashna imai khapi. Le takya phe. Toshke chamukta hai. They ask me questions because I'm a speaker and I understand and I can translate. They ask me, what does this say? How come they gave me this one pill when I'm supposed to be taking this other one? But a long time ago, we had Chris Bordo up there. He would walk around, talk to patients. He was a real friendly guy. He spoke Lakota. You need somebody like that up there. We need it back up there. Although we're losing our language, there's still some Lakota speakers here. There's Lakota patients. That's what's supposed to be up there in our treaty, according to treaty rights. Lakota ki trokiapi. But no, we're not being treated that way. But that's all I want to say. Thank you.
Ray?
Thank you, Melody, for coming. I just kind of wanted to add to a couple of my colleagues' concerns on the scheduling and refills and whatnot. And a lot of them come from elders from my community. And before the pandemic, IHS used to have a specific day for like an elder clinic where elders were able to go in and get seen, get their refills done. And it's just a request that IHS can bring that back or consider bringing that back. That was from my community, so thanks.
One of the things that I had forgotten to ask earlier was, when is our IHS going to come up with a My Chart? A My Chart portal, the same as like what Vera and Sanford have, where a patient can log into their account, see what their appointment date is, maybe even I think you can schedule an appointment through there. Also seeing what the results of x-rays, rather than sitting there waiting for things. Is that coming along, or where are we at?
Now, any patient that wants to get the access to their chart, they just need to connect with our HIM, and they can give them an access key. We've been providing, at some of our events, we've been providing some of that information, how patients can get access. What I'd also like to do is set up a kiosk in the outpatient area. There may be patients that don't have internet at home, but would still like to get access to their chart, so that they'll have the ability to do that. But this is something that we've had for a while. And we may need to just re-educate on how patients can get that access.
Yeah, it sounds like it, because I never even knew that you guys had that.
Yes.
Do you guys have an app, or do you have to go through the internet?
It's not as sophisticated as some of our external partners. I too use my chart with my provider, which is rare because I don't get sick that much, but It's not it's not as intuitive, but they can at least go in there, they can print out their prescriptions, they can print out the summary of their visit if they like, you know, that type of information. So it is kind of limited. I will make sure that we do an education outreach. We'll put it on Facebook. We'll have some information also available at points of care throughout the hospital.
Okay, thank you.
I have another,
Martha?
almost forgot. Your housekeeping staff, when you sit out there on the waiting room, this like happened like last week. There was a guy that was, you know, just vomiting and, he had a real bad bloody nose. And I tried to get somebody to help him, but afterwards, housekeeping staff didn't even come for a long time and wipe whatever mess it was, and didn't even tend to wipe the chairs down. And when you sit up there, you hardly see any housekeeping staff come out and actually wipe those chairs down where people touched. You know, there's diseases out there that some of us can easily catch, especially by touch. So I think you really need to let your housekeeping staff know that, you know, to really get on them about cleaning, especially in that waiting room area. Thank you.
Mr. Chair, I have a question too.
Go ahead. Wayne.
Oh, okay, I can go ahead.
Hey.
Thank you, Melody, for coming down. I have a lot of colleagues there have brought up some good points. One of them specifically that I have is that I've gotten a lot of calls. Who do people call when they can't get through to outpatient? And they are trying to check on if IHS ever gave them an appointment. And it's just crazy that, you know, the last couple of weeks I got this question posed to me. And then here all of a sudden I kind of had myself a problem with health. And then next thing I know, they said, we're going to have to refer you out because we can't do that kind of care here. And I'm on basically day 4 of no call myself when they said it was going to be the very next day. I usually refer them to Callie Raymond, but I don't know if that's the proper person.
Thank you. I will need to make sure that we get a fact sheet out available just for all patients who to contact if they cannot get a hold of anyone in outpatient. I make myself available at any time. Any patient can call the main line and get through directly to me. I certainly will be glad to help navigate through that system.
Okay, will do. The other question is that I've referred it farther up myself, but we are getting reports, as Sherry had said, there are positions open that they said that in-house applied for and they met the qualifications previously, but then all of a sudden they added qualifications and then now are reopening positions for advertisement again. Is this happening?
Not that I am aware of. The positions are actually the positions are classified at our area human resources. Our managers locally don't have, you know, we have input to that, but we don't have, we're not the subject matter experts on those. And I have never heard of a position that was advertised and we added duties onto it later or required skills or qualifications.
After the fact. Okay. I hope not. The other thing is that, you know, dental, as a couple of the other colleagues have brought up, you know, they don't do a lot of work. Simple, especially like root canals, where it's preventative maintenance. And we actually had, I don't want to say their name, they were emergency services person, and literally the action that happened at this dental caused them to have to be off the street, basically out of work for over 2 weeks, because they knew they couldn't handle it, but they continued on, and that individual was hurt worse than they should have been. And also now they're worried about, because they have lost additional teeth compared to what was supposed to have happened. And that is just, it's mind blowing to me that we could have literally done just a root canal, and that individual would have had all their teeth, but now they're short some, and they were out of work, and they're one of our emergency care providers. So I think we really need to look into either getting them what they need in that office to take care of our people and their teeth. If you don't have teeth, obviously that impacts your life. That impacts the longevity of your life and the quality of your life. And I just don't like the idea of always having to just, oh yeah, we'll pull your tooth. You know, that's archaic. Thank you.
Here.
Thank you. So why was CMS here and what were their findings?
CMS was here in response to a patient complaint.
Okay.
And we just received our findings yesterday, which I shared with the president and with Skyla. We were found to be in substantial compliance. I did share with you just kind of a workflow, kind of a sheet, what happens internally when CMS or Joint Commission comes to our door. Immediately, we really go into an incident command thing, scenario, and I will do my best to notify the tribe when they arrive the next time.
Okay.
And what the follow-up on that is.
Okay.
But we did receive a CMS visit and a Joint Commission visit, both that were unannounced. And for those, we have been found to be in substantial compliance.
Okay. The other question that I have is kind of regarding around financials. Thank you for sharing these financials here with us. I know that flyouts are quite expensive. And I guess my question is, everyone that's getting flown out, do they absolutely have to get flown out, or are there those who can be taken by ambulance? And that's kind of a rhetorical question, because I was told by one of the flyout teams that they flew somebody out with a dog bite on their ear before, and that could have been taken by ambulance. And we're seeing a trend where people are just constantly getting flown out. And I understand that that's important and it can be like best for the patient at times. But in instances where it's not, like a dog bite to the ear where you're not bleeding out and there was no risk of rabies with that animal, why are we spending funds? Because what does a flyout typically cost?
So on average, when someone is flown out, we can estimate, and we actually review those on a daily basis. We recently hired an emergency room physician supervisor, and she monitors those on a daily basis and makes a determination. Yes, this is appropriate, medically, that it was appropriate to get that individual flown out. We do our best to use the ambulance services when they are available. It's kind of a catch-22. Sometimes we have to wait for the ambulance because it's more appropriate for an ambulance. And then we've got somebody in our emergency room, waiting for over 24 hours or what it could be. But they're really reviewed on a case-by-case basis. And we try to do, the goal is to do what's best for the patient medically.
Okay. And I guess the reason I'm raising this concern is because if somebody's getting flown out for something like a dog bite, and the funding for that, I mean, what did you say the average cost of that was?
It's about $10,000.
About $10,000 for something plain and simple, but other than that, if they need extra medicine to keep them alive or support them on the flight,
So
and it would increase the costs?
yes. So the emergency room is held, they're supposed to be triaging all of those.
Okay,
And in fact, you know, on some of them, like those individuals that are here for a suicidal intent, you know, I mean, it's a balance that we have to do. Many times what we're finding is that there's many scenarios, but one of them is, all the beds everywhere throughout the state are full. And if we're trying to get someone into a mental health bed because they need a higher level of mental health than we can provide for their safety, the emergency room will contact one of us in leadership. We go on a rotating on-call basis. They contact us and get that authorization to medevac that patient out rather than wait for ground transport.
okay,
You know, we want that patient to get the care that they need. And we do our best to be mindful of the limited funds we have for those types of,
okay.
because those particular come out of PRC, and I absolutely know what you're referring to. And there have been a couple cases. I'm not medical, I'm not a nurse, I'm not a doctor, but I do participate in all PRC, so I have just a working knowledge almost on a daily basis of where our funds are going for PRC. And absolutely, our team is supposed to look at those on a case-by-case basis and see, what is going to be the best option for this patient.
Okay, thank you. I am trying to get at the point that I want to make sure we're spending our money properly and as best as we can. My colleague and I were talking about the level 1, how it's 100% funded, but the level 2 and 4, it's as funding allows. And one of the biggest issues there with that situation is something that Councilman Frederick addressed, is preventative care is very important. So you don't send somebody out because they're a level 4 and then it ends up costing you $100,000 later. And I know that has happened because it's happened with me. PRC denied a pacer, a heart monitor for me. And 6 months later, it ended up costing you guys $100,000 because you had to fly me out. And I'm just one person here. And there's probably, hundreds of people here that go through that same thing. If more time was taken and more care was given to the patient, more attention to preventative care, or even trying to find out the root cause of their issue, we wouldn't be just dealing with level 1 all the time. So I think really going to making sure that patients are cared for and thoroughly examined is very important. The other thing is that I would like to address is, I know your emergency room is taking a lot of hits today, but I got a complaint from one of our tribal employees. That person took a patient took an inmate to the hospital because they were having withdrawals. And I know that you're not a rehab center. However, you guys are a hospital. And the nurse asked this employee, why did you bring them here? And what am I supposed to do with him? And this is one of our tribal employees and one of our sergeants at our adult corrections facility. And a lot of times, that there's a meth epidemic here. And a lot of times people that do go to jail, they are suffering in there because they are withdrawing. So I just want to make sure that you have a really good policy and a good working relationship with our tribal programs, and that nurses and doctors there are respectful and treat everybody as a blank slate and not judging people, thinking everybody's there on drugs or cocaine or, and just treating our patients with respect. When our officers or our police officers or our corrections officers bring people into the hospital, it's because they can't care for them. They can't offer that care for them. So they're leaning and depending on our hospital. So I just want to make sure that they're treating them respectfully and not making comments like, what am I supposed to do with him? Why are you bringing him here? If I can get a name of who the nurse was, I'll share that with you. Thank you.
Pam?
Sorry, full of questions. One of the questions that was asked of me was, what is the protocol for the emergency when someone passes? What is the protocol for the family? There's several families that have indicated that they're taken through the ER when in fact they were needed to be taken to the spiritual room. Do you know what the...
We will, we should be, consulting with the family and ask them what would they like us to do, and we should be able to give them what those options are.
No, I mean, I don't wish death on anyone right now. No. I don't know how to make an example. Okay, so this person was brought in through ambulance, or maybe the family member rushed them in. So they're inside the ER, the family member sitting out in a waiting room waiting. And then they come out and they get the family member that's waiting. Now, what's the protocol? Why take them back into the emergency room thinking that their family member's still alive, not even telling them that they passed? They took them back into the emergency room, but they had already took the one that passed to the spiritual room. That's why I'm asking, what's supposed to be the protocol for something like that?
So I want to make sure I'm understanding you correctly. There was a patient that was brought in and the patient passed away. The family was sitting out in the waiting room, and the staff did not tell them that their family member had passed away, but brought them through the emergency room.
Yep. And then took them to the spiritual room, and that's how they found out that they passed.
That's, I don't know, but let me check into that. Let me check, find out what the process is and what should have happened. But in this instance, what you're saying is the patient wanted to know before they were brought back to the spiritual room?
I mean, I would think so, because if a family member is inside the ER and they're getting worked on, I guess you say, and I'm being brought back into the ER, I'm gonna assume my family member is alive back there. That's why you're taking me back there. So, I mean, I guess that's what I'm getting at, is what is the actual protocol, or what do you guys have in, what are you supposed to do? Isn't somebody supposed to come out and tell me that they didn't make it and then take me to the spiritual room, rather than just drag me through the ER and then take me to the spiritual room that way?
I see what you're saying. Let me check to be sure. My gut tells me it's handled on a case by case basis. If there was other patients in the waiting room, I don't know, but staff should be sensitive to the family members. Absolutely, whatever, to me that would still be on a case by case basis. But you know, just brought them in and consulted with them before taking them to the spiritual room.
And then, not to change the subject of questioning, but the other one is, we have people who need, dentures. What do you do in those situations? Or what is a person supposed to do when they need dentures? I mean, especially if you went here and they pulled your teeth out, so now you don't have no teeth. Are they consulting you as in that they're going to give you an appointment to fit you with dentures? And does the hospital pay for those dentures? How does that work?
I know that we have done dentures. I know, and that should be a one-on-one discussion with the dentist, you know, when that happens, you know, at the point of care. The dentist should be talking about a treatment plan. Okay, we're gonna have to pull your teeth and, you know,
But I mean, does IHS pay for that?
we have, yes.
I mean, but you're saying have, that's past tense, so.
I believe it's on a case-by-case basis, but I'll confirm that.
So what would be, you say case by case basis. So what creates a level of not paying for it?
I will find out and get back to you.
Thank you.
Sure.
Thank you.
You-
So I had an incident with one of my community members. She took her baby in for a checkup, and the nurse was a non-member, not from here, and she threw the baby's umbilical cord in the trash. And she threw it in the hazardous trash and then refused to dig it out because it was the hazardous trash. So I just want to recommend that all the nurses and outsiders that come here understand some of our practices, and that the checkpa, we keep that. And there's other things as well that a cultural sensitivity or something. Do you have a onboarding like regiment when you bring them on?
Yes.
Okay. Itantra, do you know if we have any cultural advisors here that could that we could refer IHS to review part of their onboarding?
I think we do.
Okay. I would like to have you work with somebody locally to review some of your onboarding, especially when it comes to like cultural practices, so that mistakes like that aren't made again. Thank you.
Good morning. It's good to see you again. I just was thinking, I know that like pharmaceutical billing, that could bring in a lot of revenue. I know that I hear there's a lot of departments within that kind of don't get along though. Do you think that you could maybe perhaps work on the morale and the rapport between the departments, and maybe look at something within the pharmacy for the billing, because the billing, it was bringing in a good chunk of change, you know? And if we can get something going like that, you know, maybe we can help ourselves to, you know, they always say God helps those who helps themselves. So, you know, maybe we can figure something out, because I know we have tribal members out there. I mean, you walk through the facility and, you know, it's like a family reunion in there. There's a lot of people related that work in there. And so, you know, maybe we can ask them to get along better so the departments can do their job, you know, in the right way, rather than, you know, on being mad at the next person in the next department. So this cannot get done. You know what I mean? But I think pharmaceutical billing could be something that we really look into, because if we do it right, we can start making money on it, you know, can bring in millions. And it just takes opportunity. Someone just needs that opportunity from within, because like I said, you walk in there and it's family reunions going on, you know, and you think that they're just visiting, but they all work there. So I just want that addressed as well. So thank you.
Thank you, and you bring up a good point, and we are billing. It's one of the measures that we we track on a monthly basis, the pharmacy point of sale billing. And we've got one of our techs that has been trained to do specifically that. And we're transitioning that person from, going from tech duties to point of sale full time. And I'm glad you brought up the, just the interactions within the departments. Leadership is taking a look at that as well. We've recently started doing leadership rounding and really just trying to engage better with all staff.
Well, that's good. And, a lot of it too is like, if the staff are related, it's hard to reprimand your son, it's hard to reprimand your auntie, when auntie messes up. So I think that could be something that looks at, because I know that a lot of the complaints stem from not being able to voice their opinions or not being able to voice their complaints because of all the relatives that are involved. So thank you.
Jordan?
Thank you. So I just have a question about like, how are you going to resolve these issues? Like, I feel like every council meeting that you come to, we have the same issues and they never get resolved. Every meeting we come back and it's the same issues that we're bringing forward. So I guess I would just like to see it change now, because you take notes every time, or have your other colleague take notes, and we come here and our colleagues have the same complaints every time. So how can we fix that?
Thank you, and that's a really good point. I just this week I have been working with Skyla, and we've got a meeting that is set up on October 3rd. And what I've requested is to meet with the health board, and that way we can give some updates directly. With the health board, we'd like to hear their concerns. We have some opportunities, I think, that'll be good. Some of them I've mentioned, some of them are in my reports, but absolutely open up that communication. It's unfortunate, I think we all sit in that place where we hear complaints about everything and you don't get to hear the good things. And there is a lot of good things that are happening at the hospital, but we do absolutely need to hear the concerns. I know that yes, Francine did provide a written copy of the report of all the questions that you brought up, but as I'm looking at them too, we're back here talking about the emergency room, the dental department, and those types of things. And it didn't go unheard the last time. I think the issues with the emergency department and the cleanliness, I think if you go there today, you're going to see that the facility is clean. And if it's not, then I need to know about that. You all have my direct contact information. I need to know. With the dental department, there's some things that we're doing internally. It's not going to fix itself overnight, but it's high on the list of priorities, because I come in early every day and I see the patients that are sitting there at 7 o'clock, and they've got dental issues, that their mouth is hurting, and they've got something that needs to be taken care of that day. And I put myself in their shoes, and I don't, that isn't something I would want for me. And, we've got to be able to see those patients at the very minimum, make sure that we get them triaged that day, and whatever their dental need is, make sure that we're attentive to that. We have a long ways to go.
Thank you.
Lisa?
And one last thing I'm going to ask you, but I know CMS recently made a visit to IHS a week or so ago, maybe more than that. Are there any discrepancies, or is there anything in the report you can share with us, that any findings?
So they wrapped up their visit with us on September 1st. And I just got the report yesterday, and we were found to be in substantial compliance. And on the report, there are a couple issues that we have to respond to. I'm just trying to think of what they are off the top of my head. Some of them, 2 of them had to do with updating our policy. We need to make sure that the policies that are there, that all staff are following those. and making sure that we have our competencies in place. Like one of the findings was making sure that when we have a suicidal patient that's in the emergency room, and we have a staff member to come in to sit with them, they have to be competencied for that. And so the surveyor went to the file, that competency was not in there. So we've since then rolled out a process right now that we were finalizing to make sure that all staff members are competencied to be a sitter when they come on board, and that will be an annual review. Not necessarily saying that all staff will serve as a patient sitter or an observer, but we want to make sure that that's a mandatory training that all adhere to.
With just those minimal.
Yes, I believe that all of the items that were found, and I think there were 4 or 5 of them. A lot of them are things that we're glad in a sense, because we always look for opportunities for improvement. It's going to allow us to improve those systems, those areas.
Also, do you know how long the contract is with Tribal EM for the emergency room?
That contract is managed by headquarters, so that's not managed locally or even within the area.
Area office on?
Yes, but I do know that that contract is coming to an end. I believe it was a 5-year contract.
Yeah.
And they just got they got a 6-month extension on it.
Yeah, because during the diversion, when the emergency room was shut down, that was part of the plan, was to contract that out. So I just have questions maybe that I need to address the area office, but I'm just wondering if IHS is planning on taking that emergency department over again. Because like with complaints coming out of the emergency room, now do those go to you, or do they go to Tribal EM, or do they go to the area office?
The way that works is, let's just say, I'll give a
Like what I've
scenario.
seen in there? Yeah.
I'll get, so if it's a cleanliness issue, that's us. That's
Okay.
absolutely us. And we have federal oversight over the emergency room. So that is also with us. And we've got a process in place for, let's just say that
Like
a patient
care?
comes in and the nurse is rude. And that nurse happens to be one of the contract nurses. So we have a weekly meeting with Tribal EM and also with the core, what's called the contract rep of that contract. And we bring any issues to the table, and we let them know, because we don't individually supervise them. We have to go through this process, and sometimes it's on the spot. For example, in this instance, we absolutely go through the core and notify them, but Whitney is the supervisor over those tribal nurses, and it does reach her, and she handles it. And the same thing on the provider side.
Okay. And so as far as the contracts with the outside healthcare facilities, such as Monument, Sanford, and Avera, who pays those? The area office? Like the medical bills that are accumulated when we do flyer transport patients out?
Those are paid through PRC.
PRC?
Mhm.
Okay. Yeah, I was informed that the Winter Hospital was awaiting a bill. That was about a month ago, but I don't know if they were paid. But I would just, it's just my thoughts that patients waiting in an emergency room for 2 or 3 days or longer for a transport, is that because a bill hasn't been paid to like Sanford
Never.
or Vera? Or is that,
Never.
or is it that healthcare facility waiting for room actually, or?
What we have found ever since the pandemic has started is that a lot of our external facilities are full. And that they are experiencing, what we're told is they're experiencing the same issues that we are. The shortage of nurses, the shortage of support personnel. They're experiencing the same thing. So, you know, we work with them, we consider them our partners, and we work with them. The billing is not an issue ever for providing patient
Okay.
care. Patient care always comes first.
I was just wondering, because I see there was a patient that was in the next bed over, and she had discharged herself, and her husband had taken her to Monument, and she was accepted into their ER and given a bed. But I was wondering why she waited for 2 days in our emergency room for that, but she went directly to Monument herself, so. And in cases like that, I just had an afterthought if IHS would still pay for that because she discharged herself. So I guess it's a case by case basis.
It is. It is. Absolutely, it is. And we look at them case by case. And when you hear patients, please, when you hear patients that have been denied PRC, their letter tells them, and I know that that letter is terrible. It's a lot of jargon that's written, in my opinion, not patient friendly. But the bottom line is that they need to appeal. And those appeals come to me. And once those appeals come to me, I look at it from an administrative perspective. And we also take it back to the PRC team. And we'll find out, for example, many times what'll happen is if a patient is out in Rapid City and something happens, and then they go to Monument. And that's what we know, is that they went to Monument and we receive some information. And we deny and it's for a service that we could have provided here. So we will deny that. Let's just say we deny it. Then the patient receives that denial letter. They appeal it. It comes to me, and we find out from looking at the records that they were taken by ambulance. And so, just depending on the situation, case by case basis, we cover that. You know, if they're taken by an ambulance anywhere, that is automatically a priority 1, and we have to cover those.
So priority 1 basically is like life or limb.
Correct.
And so does PRC ever expand that to priority 2s, 3, and 4s? Does it ever open up during the fiscal year?
I'll be glad to provide a report that shows how many we paid. In fact, we have been paying up through priority 1s through 4s up through July. And then, you know, it's getting towards the end of the fiscal year. You know, that bucket of money is kind of short.
Yeah.
And so once the end of the fiscal year ends, you know, we're going to go back and see if there's any of those cases that we had to defer, review those again, and see if we can get them in.
Okay, thank you.
Sure.
Thank you. You said something earlier, but I just need some clarification on it. You said that the position, I can't remember the title of the position, for the lady that just left and she's been relocated. Quality manager.
Yes.
You said that she's still occupying that position. So does that mean our budget from our IHS is still funding her salary?
I'll have to check on that.
Okay, if it is, then what are the steps that we need to take to stop, or that you need to take to stop that from happening so we can advertise that position and get somebody in there?
I will get back to you.
Okay, thank you.
Any other questions for Melody?
Mr. Chair,
Yes, go ahead, Tennille.
thank you. Hello, Melody. I just had a concern about the dialysis patients. When it comes to PRC, I want to understand that better in terms of, say, they have an emergency while they're at dialysis. So for example, my mother, she goes to Gregory, and they had an emergency, and because PRC had failed to pay before, they would not help her, and they sent her home in a lethargic state, and she was really bad off. And what I'm asking is, what you said only emergency cases, but would that not qualify as an emergency if they're non-responsive and what do you think about that?
I would have to look at the record and and take a look at the denial, and I'll be glad to do that. If you want to, just give me a call and so we can discuss the specifics, I'll be glad to take a look at that for you.
Thank you.
Anyone else have anything to share with Melody? Any more thoughts, questions? If not, we'll give her back to IHS.
Okay.
Yeah?
Yeah, I'd like to make a motion, that when times like this, where IHS, I'll reword the motion, but I just want to explain it. Times like this, when IHS comes into a time of no appointments, no providers, phone lines going down, computers going down, things like that, that should automatically red flag you to contact the tribal chairman, our chairman of the health board, and our health administrator, to let people know what's going on. And this goes back to, the refills, even up to past that day that all that was done, there was still people that were being referred to the ER. And, that shouldn't be happening. It really shouldn't be happening. ER, that's not what ER visits are for. ER visits aren't for your common cold. They're not for headaches, migraines, whatever you call them. That's not what ER is for. ER is supposed to be for, traumatic injury to your body. So the minute something like this happens, whether it's 2:00 in the afternoon or 8 in the morning, I guess my motion will be that anytime that there is any kind of immediate crisis that happens with the IHS, that there be an immediate phone call to the tribal president, the health administrator, and the chairman of the health board committee. And that an immediate, what do you call that? Media outlet be done to the public. I mean, you probably, in your mind, you're probably thinking you're doing it, but it needs to be done, because if Sherry doesn't sit on health board, but health board knows what's going on at IHS, that puts her in a bad position, because she doesn't know what's going on, and it's only health board members that are able to help the public, when that is really your job as the CEO of the IHS right now.
Absolutely, absolutely. And I will make sure that I have the contact information, for the tribal chairman. Of course, I have Skyla's contact information, and for the chairman of the health board, and just let you know when, anytime that we have, joint commission, we have, utility failures, those types of things, anything that places could reduce the scope of services that we're providing over there, to absolutely let you know, because I know you're getting contacted by your communities.
Yep. And I'm also going to ask that you follow up with that immediate, with the written to the tribal leadership. That's my motion.
Pam, or did you get the motion?
Yeah.
Okay, second by Jordan. Question by Martha. All in favor?
1, 2, 3, 4, 5, 6,
7, 8, 9, 10, 11, 12, 13. Dwight?
Oh.
Tennille?
Yes.
Donna?
Yes.
16. Opposed? 0. Not voting? 2. Motion carried. Sure.
Thank you. I'd like to make a motion that, the president drafts a letter, immediately to, President Biden and to IHS requesting 100% funding.
%100% funding?
Opposed to the 55% funding that we're currently receiving. And if the letter could also recognize the lawsuit that was currently in our favor.
Like refer to that in that letter, maybe?
Yes.
Do that. All right. You're moving, Sheriff, to do that, your motion? Okay.
I think that lawsuit part out because that's something that needs to go.
Oh, you want us to deal with that lawsuit separately?
Yeah, that needs, I mean, this body needs to deal with that on.
So we just deal with the funding part?
Just request the funding?
Okay.
Okay, can omit that part about the lawsuit.
All right. Sheriff has moved. It was seconded by Micah. Question by Jordan. All in favor? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13. Dwight?
Yes.
Tennille?
Yes.
Donna?
Yes.
16. Opposed? 0. Not voting? 2. Motion carried. Okay. Micah?
Just a couple of comments. Thank you for coming down, Melody. Like my colleague Jordan had talked about, the last, I mean, I don't know for how long when IHS comes down to council, there's always the same reoccurring themes with housekeeping, patient care, staffing issues, emergency room, employee treatment, which some of those are understandable, but at the same time, I think you would make a good politician because you don't address some of our questions directly. And I don't know if that's because you can't, because of area office or just because maybe you don't know. I do appreciate, this report, but it's the surface level questions that we may have had last month or the month before. And a lot of our questions and what a lot of my colleagues have asked are kind of in the nitty gritty of the doings at IHS. And it's, your comments or responses back to us as well. Let me look into it. I'll get back to you. Responses like that. And it's frustrating as a council rep sitting around this table. We keep talking about the same things and we keep getting the same answers or responses from IHS. And I just, want to go on record that I don't appreciate that because we don't get nowhere. There's some things that are understandable with the politics and red tape and everything that we have to work through as a tribe with area office with IHS. But you've been in your role for, how long have you been in your role as the CEO?
A year and 11 months.
Okay. And is there, as the CEO of IHS, is there anything that you think you should be reporting to council, but because the tribal council isn't requesting certain things that you don't report on it?
Absolutely not. You know, I'm here to be of service to you and your communities. And I too will go back and address these issues. I know that, you know, some of the issues that were covered here today, are, you know, we do track things like patient complaints, and we do a drill down on those things. And if a patient has complained and they put it, for example, if a patient has complained and they got a complaint in writing, they do get a letter. You know, there's some things, I know there's a lot of information here. We do report on a quarterly basis to our governing body about patient complaints, about those issues. I did hear you about the emergency room and the cleanliness, and I welcome anyone to come back over there now. You know, I see these as actionable items, and I do want to provide a response to you that is going to work for you. And I'm hoping that you can see change. You know, that is my goal. I know that communication can be better. I'm glad that, you know, sometimes it's hard. We get in the moment over there. And absolutely the first thing I should do is just notify you all that, you know, we've got something going on over there. You need to be aware of it. I'll make sure that that formal documentation does go out. And I welcome any opportunities for improvement. And I don't want it to be a redundant conversation. Sometimes we see things internally that are changed, but you don't see that, you know, and you, as I mentioned earlier, you get to hear the complaints, but you don't get to hear the things. And I would like to have a venue to share that as well. I think a step in that direction is having this meeting with the health board and making that a regular meeting, because we, you know, I too want to see the change. We have the same goal.
What, I guess follow-up question is, what is your vision for our hospital, for IHS?
For us, you know, of course, is to provide the highest quality care. You know, I came here because I think that I have a skill set to offer the people of the Rosebud Sioux tribe. And I think, you know, that we have done a lot of good things, you know, over at the hospital. Our vision is to provide the highest quality care possible to our patients. When I do new employee orientation every week, I do it. I personally take out, you know, I take time because I want to invest in the future of that hospital and the people of the Rosebud tribe. And I tell them, whoever walks in that door, they should be receiving red carpet treatment. That is my expectation as the CEO. And if that doesn't happen, then I need to know about it so that I can address it. You know, that is my goal.
So is your expectation of our tribal membership receiving the highest quality health care with the resources that you have currently, or are you doing things to gain more resources so we can have our, you know, we can start delivering babies, we can start having foot and doctors come in, those types of things? What is your definition of that quality care?
So one of the biggest topics that we have right now is access to care. And, you know, we are, as resources allow, we want to open up evening clinics. We want to start the geriatric clinic. We'd love to open up. We've had a couple weekend clinics. We've had really good participation. We are also working on the plans over there to reopen up delivering babies there. I don't know if you're aware, but we've got a project that has been funded for the expansion of women's health. And what we decided to do with that, what we thought would be the best thing, you know, because our wall can only go out so far. So it's an expansion project. So what we are doing is actually going to be renovating the entire second floor to open up OBGYN so that we can have labor and delivery back open up. so that we can bring a general surgeon on floor. The plans for that are supposed to be completed by the end of this year. You know, and we're going to be asking for a lot of patients. Right now, we're trying to figure out what it's going to, how we're going to work with patients, because it is going to impact the outpatient care. Because we're going to be putting a floor above the atrium. We're out of space. The hospital is really out of space. So we've got to deal with the space that we do have and really try to maximize that resource. So, you know, I mean, we're on the same page. Maybe you don't hear that enough from us. You know, I'll be glad to share, you know, project information. We're in the process of making plans to remodel the patient registration area, so that's a lot more patient friendly. You know, but there are things that are happening, projects that we've all been working on to try to make that a better place for patients to come to.
And so I appreciate that information. And so that's, you know, two additional things you just spoke to that had I not asked the question, you would not have reported on, you know, and those are good positive things for the hospital. So I would like to, if nobody objects, entertain a motion to have the CEO of IHS bring a department manager or have them accompany you to answer questions that you can't answer for us. That's my motion.
Okay, is there a second to that motion? Garrett? Okay, question, share. All in favor? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14. Dwight? Oh. Daniil?
Yes.
Donna?
Yes.
17. Opposed? 0. Not voting? 1.
Thank you.
Thank you. Sure. Sure.
Thank you. Also, I don't need any names and I don't think the council needs any names because I know you can't give that. But could we, when you come to bring your next report, could you bring us a list of all the referrals that are denied? The number of referrals that are denied and what those diagnoses are? Okay, thank you.
Pam?
Just full of questions. What is the, what's the procedure for, PRC when there's referrals done for a patient to go out? Who's supposed to contact the patient? Is it PRC, is it the doctor, or is it supposed to be the facility that's going to see them?
So the process is, you know, when a patient sees any of our providers, whether it be in the emergency room, inpatient, outpatient, it doesn't matter. The provider will enter a referral into our referral system, and the PRC team makes a decision on that referral. We do a medical priority on that. You know, we go through that entire process, and then regardless or not, the PRC team will make that work with that patient directly to make that referral.
So, let's say, needed a referral out. I know that the primary care provider, PCP, had put in the referral. And let's say nobody contacted me from PRC. And then the next hospital visit, I see the PCP and they say, so how did your appointment go? Who do you make that complaint to?
It can go to any of our managers. It can either go through the hospital liaison. I'll gladly take that complaint and deal with it myself and find out what happened. But I do know that our PRC team that's what they do. They make appointments all day long.
Okay. Then, how are we as far as equipment, up-to-date equipment at our hospital?
It's going to depend on, you know, where the equipment is right now. I know that some of the high dollar equipment that we've got, that are in the works, we've received a lot of new medical, equipment all throughout the facility. You know, we too, received some ARPA funds, so we were able to use that. We're in the process of, we've been slated for a new CT scanner. So that's going to be coming on board.
Whatever happened to the plan to get a MRI machine?
That's still on the table. That's,
You know, that's been on the table since the last time I sat on council back in 13. So, I mean, why does it keep getting pushed to the side when that's kind of a lot of our people's referrals out?
so there's a couple things that are happening right now. I can't speak for the past, but I have been in discussion with the VA. The VA has I've been talking to them. They are ready to share with us their MRI machine, and it's just it's a logistical matter of routing. We don't have enough electricity, and that has been an issue. Is we don't have enough electricity in the hospital itself to support MRI within the building. So, but we found out a way to route the line that's outside of the hospital, and right now it's just a process of making doing the logistics of either renting or working on further with the VA to get an MRI machine here.
Okay, and then
So that should happen. I'm hoping within the next year.
and then our upstairs for surgical, where is that at? I mean, have we gotten any surgeons in for that, or? Because I do know a while back, there was a time when they were repairing upstairs surgical department to be able to do those things. Has that happened?
So the surgical department is part of the remodel and the expansion. The complete second floor is being renovated to accommodate labor and delivery, women's health, and surgery. We've already got the floor plans almost in final draft for surgery.
So when do you see that up and happening?
The contractor tells us that the floor plans are expected to be done by the end of this year, with construction beginning next year.
So maybe another 2 years before surgeries, huh?
I'll know more next year. You know, I don't want to say a date and be held to that, and then it doesn't work. You know, sometimes, you know, with construction projects, they can take a little bit longer than expected.
How about our OBGYN department? I do know the last time the lady that was our doctor in that department, she was going to be having a baby and having to take time off. I believe it was last month that she had her baby, but not definite. But has she been replaced with anybody, or you guys have her coming in certain day of the week, or is she not utilizing her maternity leave, or what's going on in that department?
So we do have I don't know if we have two on site today, but the majority of the time we will have two nurse midwives on site. We knew that there was going to be changes with her, and we had a contract written, and we've got coverage for the nurse midwife.
Okay, thank you.
Anything else for Melody? We'll need a motion to accept her report. Martha? Second by Dira. Question, Jordan? All in favor? 1, 2, 3, 4, 5, 6, 7, 8. Dwight? Danielle?
Yes.
Donna?
Not voting.
8. 8 in favor. Opposed? 1, 2, 3, 4.
Dwight opposed.
5. Janelle? She's off. Donna? She's not voting. Opposed? 5. Not voting. 1, 2, 3. 3 not voting. Yeah. Okay. Motion carried. 8, 5, 3, right? 8, 5, 3.
You didn't count for this last time, did you?
No, she opposed. She opposed. That's fine. 8, 5, 3. Okay, Melody, thank you for coming today. It's good to see you here, have you here. Thanks. Pam, your thought?
Chairman, I just want, for the record, the reason why I opposed IHS's report is because one of my colleagues had a concern with her not able to answer some of the council reps' questions. So that's why I oppose approving her report. Thank you.
Okay. We have Dean here from BIA. He's been patiently waiting to get on.
Chairman, again, I don't know how my other colleagues feel, but for the last 2-3 months, I have asked repeatedly to have the BIA superintendent here for a council meeting. That hasn't happened, so I am asking to go ahead and dismiss Dean from our council meeting, and I'm asking that the superintendent be here. If we have to have a special meeting for her to be here, let's do that, because I'm tired of hearing from somebody who is not the superintendent of our tribe, of the BIA. So, yep, so with that, I'll dismiss
Okay.
Dean.
We have a motion to-
Yeah, I would also like to back Pam up on that because I have a lot of calls concerning our reservation and she's never there. So is she working remotely from her home in Arizona, or do we have a superintendent that is here on the Rosebud? That's my question, because, you know, if we went to Hopi Land or Navajo Nation, they wouldn't acknowledge us or even accept us as Lakota taking care of their lands. And here we are, we have to accept her. We have to listen to her thoughts. And yes, she has good thoughts, but she's never here. So I'm just, you know, I want to put it on record that we need a superintendent that's from our area, that knows us, knows our lands, knows our issues, and shows up and doesn't go to Arizona or New Mexico every chance she gets.
Okay, Pam's motion is on the floor, been seconded by Dara. Steve questioned the motion. All in favor? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. Dwight?
Oh.
Tennille?
Not voting.
Donna?
Yes.
14. Opposed? 0. Not voting? 2, 3. The motion carried. Okay, Dean, thank you for coming over. Appreciate you being here.
How you been? Yeah. Real quick, Chairman, could we get Can we get our tribal attorney to draft a resolution regarding the BIA superintendent? I would like that resolution brought to the floor to area and to the superintendent that she be here at our meetings as she is on our constitutional agenda. She does need to be here and that it be her. So all her meetings be scheduled around that, not during our
Have Eric draft that up?
Yep.
Okay.
Thank you.
All right, you want to take a lunch break? Are you making a motion or is that
Yes,
just
that
a
was a
request?
motion to have
A motion? Second by Steve. Second by Steve. Question by Jordan. All in favor?
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13. Online.
Dwight?
Oh.
Daniil? Donna?
Yes.
Opposed?
15, 0,
Not voting?
2. 15, 0, 2.
One on the watch.
Okay. We can take our lunch break if,
Not me.
I was gonna have some, Fremont do the prayer,
Fremont.
a meal prayer. Or are we done with communities?
I have something from my community, but I'm not sure if that needs to go to committee first. Rosebud community would like some traffic lights. Especially by the hospital.
Rosebud committee.
Okay, so send that to, transportation. I'll do that.
Attorney General, do you want me to come over, or can he do it on that? Jordan?
I just had a follow-up question on, so a while back, I made motion to, for the council donation and the youth donation report. And I was just trying to follow up to see when we would get that or when it would be available. I don't know if that's I didn't get it. So I guess just for the record, I would like it noted. Thank you.
Thank you. We got Lloyd. Hello, Lloyd, how are you?
Good afternoon, thank you.
You're on the agenda, my friend.
Oh, wow, okay.
We thought enough of you to put you on our agenda.
I appreciate that very much. Let me grab some of my materials here. Or if the council would prefer, I could be actually a little more organized on the 28th. It's however you guys would like to go forward, but I'm going to be a little bit scattered a bit.
Are you scheduled for the 28th?
No, but I can be.
Yeah.
If there's no objection.
Okay, you want to prepare for that date then?
I would if the council doesn't mind.
Council, do you have anything for Lloyd today? Okay. Otherwise, he'll schedule for the 28th.
Is there a reason why the report isn't prepared for today? Lloyd, you're always on our agenda every month.
No, I understand, and I understand that they don't always get to me either, and there are just other things that come up. Like one of the things that I have been working on is the motion that you had made last month to meet with the different departments and talk about kind of some of the, and I'm prepared to talk about those things. I just think that the council would probably appreciate if it were a little more organized.
Do you have anything for Lloyd today?
I do.
Yeah, Sheriff.
Hi Lloyd, thank you. Would you please let the council know what we discussed, during the Judiciary Committee regarding the Law and Order Code and some of the revisions regarding code? What the plan of action was there?
I need you to be a little more specific. I know that we had sent over a gun code that had been worked on by Vicky Left Hand that was working in this office, sent over Title IX regarding judges and regarding judges and SOBA and licensed attorneys, lay advocates, those revisions. I sent over a name change code, which was one of the things that came out of Councilwoman Whitepipe's motion that I meet with the courts. So I had sent that over as well for judiciary. Let's see, there were some other items. I think one of the items that came from Ms. Whitepipe's motion from the courts, we were talking about there was a habeas corpus code that was revised by Judge Routson and Judge Marshall that was sent back to the judges for review, as they were the ones who drafted that. Was that what you were referring to?
That and just the plan that we had, reserving our second meeting of the month to address and work on code?
Right, and that's kind of my understanding of how judiciary's been running this year, with one meeting set for the community, for basically community input and the programs, and the other one's kind of a working group that works on different code revisions. I'm prepared to talk about Ms. Whitepipe's motion that she made last month and some of the things. I just don't have basically an out schedule for the implementation of some of those things.
Okay, and then I'll just I would just like to inform the council that the Judiciary Committee, our next scheduled meeting, we plan to address some of the issues in the law and order code and start scheduling out the dates for the revisions and work sessions that this council requested the Attorney General do.
So if the council likes, I can discuss, some of the meetings that I've had in response to the motion regarding, it said, to set up a schedule of meetings with LES, courts, corrections, court council at the September meeting to include a report on the list of amendments with timeframes. So those meetings were held. Like I said, I just want to be a little more organized about them, and I have some notes here. I can go over them quickly.
I know on the 28th, we do have council scheduled. I know some of us are not going to be here in town during that week. If the Attorney General is unprepared to give his report today, maybe we could set aside another time for him to report prior to our October meetings.
That'd be fine.
I don't think we'll be getting,
A quorum.
we won't get definite answers today from his unpreparedness, so.
So we can let Lloyd go and move along then. Lloyd, I guess we'll get a hold of you later on down the road.
I appreciate that. Thank you, council.
Okay. Budget and finance. Pam, you have something?
Yes, thank you, Chairman. I had forgot, I needed to make another motion regarding the resolution for our tribal attorney to draft for us. And that was for our IHS area director. I know that they are in transition of hiring and whatnot, but I'd like Eric to draft a resolution for them to come to a council meeting to introduce themselves. Even though they are acting, I still want them to come here and introduce themselves and what kind of plan they have for our local IHS.
We need to have Eric draft a second letter,
Not a letter, a resolution.
a resolution.
Yep.
Second, Chair. That was your motion?
Yep.
And second by Chair. Chair, I stand by Jordan. Jordan, question, all in favor? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. Dwight?
Oh.
13. Opposed? 0. Not voting? 1. $13.01. Budget and finance. Budget and finance.
But I have 4 resolutions here.
More resolution.
The council at our last budget and finance meeting, we did refer the budget approvals that we, resolutions that we approved yesterday. One big issue that came out of our budget and finance meeting was that the tribe can capture direct contract support funds from BIA. And that money can be up to 200,000 or more. And what we found out was that that money was used to fund some of our programs through direct contract support. But nobody has approached the BIA to ask for any of those funds available, like within the last 3 years. And I know some of those funds did fund our Attorney General's office. And I think it was usually done under, and did they say the treasurer's office at the time? They don't really have anybody designated in finance to go to BIA to capture those funds. So I'd like to make a motion to have finance designate one of their employees to go capture the direct contract support funds from BIA.
Lisa's motion's on the floor, seconded by Pam. Question by Sheriff. All in favor?
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12.
Light. Opposed? 0. Not voting?
2.
What's the first number?
1202.
And we found out that in the Office of Special Trustee, we do have an amount in there of like 600,000 that the tribe can draw down, but yet nobody's working on capturing those funds. And I would also like to have make a follow-up motion to have the finance office assign one of their employees to capture any funds available to the tribe from the Office of Special Trustee.
Lisa's motion. Second. Pam, question.
Motion to have finance assign one of their employees to capture any funds available to the tribe from the Office of Special Trustee.
All in favor? 1, 2, 3.
And with our loss of revenue amounts that come from ARPA, oh, I'm sorry.
Light.
Oh. 13.
Opposed?
0.
Not voting?
1.
With our loss of revenue that went out to our chartered entities, we were pretty generous in approving them to receive the loss of revenue through our ARPA funds. Our chartered entities such as TLE and Redco, Redco, we haven't received a dividend and they're behind on their audit right now, which we have come to find out that affected a couple of our grant applications. TLE has deducted any funds that we requested for, our fair community cleanup to be deducted out of the dividend that they give us, which we already budget into our account, our general account.
You can answer this, but is there any conflict people on the Redco board?
I am.
You're on.
Mm-hmm. And I've been harping at this since July. And Wayne is too. When Clay was here, when they came and gave their verbal report, we they informed council they were gonna turn it in by the end of that week. Now it's just been going on week after week. It's affecting our, indirect cost rate. It's affecting our grant applications now, and I received information that we probably won't get their audit until the middle of October. So with that, I'll make a motion that, and this came out of budget and finance too. We had this discussion on there. Let me see. To withhold, I make a motion to withhold any loss of revenue to our chartered entities.
Motion. Pam seconded. Go ahead, Cheryl.
Is that all the chartered entities or just penalizing Redco for not?
It's all the chartered entities.
All?
Yeah.
Even though they aren't affecting our,
In that, we could use that to put back in the pool.
sounds good. Thank you.
Good question. Good. Bill, all in favor? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. Blake?
Yes.
13. Opposed? 0. Not voting? 1.
And with that, I'll start in with the resolutions. The first one will be this one from Sichongo Nation Employment and Training. Motion for emergency legislation.
Question? We can get it on the floor. Bill, all in favor? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11. Dwight?
Yes.
Paul? Opposed? 0. Not voting? 2. To approve, Lisa.
What's the number?
276.
276. Motion to approve 2022-276.
And on the floor.
I'll start with the fourth whereas. Whereas the Sichongo Nation Employment and Training Program has made numerous attempts to acquire competitive bids. It appears to be a lack of interest on year of vehicle and no communication from other dealerships. Whereas the Sichongo Nation Employment and Training Program has carryover dollars from FY 2020 and prior years, current line item out of 72,200 equipment purchases, that's a line item number. Capitalized is 75,000. That will cover the 2022 Dodge Ram 1500 Laramie in the amount of $65,750 from Liberty Superstores in Rapid City, South Dakota. Now therefore be it resolved that the Sichongo Nation Employment and Training Program recommends to the Rosebud Sioux Tribal Council adopt and approve the Sichongo Nation Employment and Training Program request to purchase a 2022 Dodge Ram 1500 Laramie in the amount of $65,750 from Liberty Superstores, Rapid City, South Dakota as a sole source.
Any discussion? Need a question? Bill? All in favor? Approving 276? 1, 2, 3, 4, 5, 7, 8, 9, 10, 11.
Yep.
Opposed? 0. 2. And
then before my colleague continues on with the resolutions, I want to make a motion that our insurance and property and supply department in the finance department work together, and I would like all of these purchased vehicles to have I don't know what you call it, I would like them to be equipped with some kind of speed monitor. Yes. A speed monitor, and possibly, I don't know, because, you know, you see them commercials where like Progressive has those plugins that monitor the vehicle. And I do know that we have some kind of monitoring going on back there, but I don't know if it's for all the tribal vehicles, but I want all the tribal vehicles that are able to be on the highways, as in our cars, SUVs, and pickups, that they're not speeding around and whatnot. I'd like to have them equipped with that type of equipment on them. There's too many complaints of all these vehicles that we purchase and that they're all speeding around.
Pam, are you talking about equipping the ones we have or just the new ones on down the road?
Probably just all of them in general, because yeah, our entire fleet, because there's just too many complaints. I don't know if any other reps hear it, but I get phone calls every day on people speeding around, and you know, it's kind of dangerous with these being our tribal vehicles, and a lot of them get run down because of doing things like that. So that's my motion, and I'm sticking to it.
Seconded by Sharon, question by.
I have a question.
Oh, go ahead.
Pam, will that include like GPS for them too?
From my understanding, we do have GPS on them, don't we?
Yes, I think we do.
I think some of them, I think we're supposed to have them, because there was something that was passed a few years ago, and those vehicles were, starting from that point, them vehicles that were purchased back then, we're supposed to start having them GPS. So that's why I'm saying, I think in the property and supply department, they actually have a monitor that if somebody wanted to know where their vehicle was at, they can pull it up, and then it tells them where exactly that vehicle is parked at, and it even tells how long it's been sitting idling and all of that. And I don't think a lot of our employees know that, but
Okay.
that is something that's already in place, and it's supposed to be on all vehicles, but
Give a timeline. Yes.
yeah, we can. I don't know, we're starting a new fiscal year, so maybe by the end of October. It's really gonna depend on the service carrier that is gonna be able to put that in, but if somebody could give us a report on how long that's gonna take, then we can probably go from there.
Okay, we need a question on the motion. Sharon.
Question by Micah.
All in favor?
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11.
Opposed?
0.
Not voting?
2.
Oh, I'm sorry. Okay, I'll start in with this resolution packet here from the WIC office. They've already gone through budget and finance and have been assigned numbers. So a motion to approve resolution 2022-258.
Second.
I'll start at the third, whereas the WIC program is a special supplemental food program for women, infants, and children, and federal funded through the United States Department of Agriculture, USDA. And whereas the Rosebud Sioux Tribe Women, Infants, and Children WIC program seeks to pay John Finn, MPHRD, LN, LRD, a rate of $63 an hour for 16 hours of nutritionalist breastfeeding coordinator contract per week to seek all high-risk clients on WIC. Will assist with supervision and train all WIC nutrition assistants, breastfeeding peer counselor, and issuance clerk. Perform chart monitoring and review and assist with policy writing, setting goals and objectives for the state annual plan requirements for the WIC program beginning October 1st, 2022 through September 30th, 2023. Now therefore be it resolved, the tribal council approves the amount above for the period noted for the Rosebud Sioux Tribe WIC program, and attaches his contract and the budget for his pay.
Any discussion? Need a question? Bill? All in favor?
1, 2, 3, 4, 5, 6, 7. 8, 9, 10, 11, 12. Opposed? 0. Not voting? 1.
I'll start on the second, resolution, motion to approve 2022-259.
That one in the packet.
Yeah, it's behind this, what I just read. It's for Golden West.
Motion to approve 259. And
I'll start at the fourth whereas. Whereas the WIC program received general infrastructure grant funds for clinic renovations and is seeking a sole source purchase of a new phone system from Golden West Technology. WIC's telephone system was installed in 2014 and cannot accommodate additional phones. New phones are needed in the newly built offices to meet program needs. Whereas the Budget and Finance Committee met on August 23rd, 2022 and is referring to the RST Tribal Council the approval and acceptance of a sole source telephone system purchase from Golden West Technologies in the amount of $26,400. And now therefore be it resolved, the Tribal Council approves the sole source purchase of a new telephone system from Golden West Technologies in the amount of $26,400 for the WIC program using general infrastructure grant funds.
any discussion? Any questions? Chair? All in favor? Raise your hand.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12.
Opposed?
0.
Not voting?
1.
Motion approved 2022-260. Start at the fourth whereas. Whereas the WIC program received general infrastructure grant funds for clinic renovations. And whereas construction of a permanent building that replaced 2 single-wide trailers is complete with Joel Moore Carpentry as the contractor. And whereas the WIC program requests a change order to replace all interior doors in the WIC building with 36-inch golden oak 6-panel doors to match the new doors installed in construction. Whereas the Budget and Finance Committee met on August 23rd, 2022 and is referring to the RST Tribal Council the approval of a change order to replace all interior doors at WIC in the amount of $15,414.11. And now therefore be it resolved, the Tribal Council approves the purchase and installation of interior doors in the amount of $15,414.11 for the WIC program with Joel Moore Carpentry as the coordinator.
For the second.
All in favor? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12.
Opposed?
0.
Not voting?
1.
That's all I have for budget.
Thank you, Lisa.
Thank you. So under budget and finance, I would like to schedule a special meeting for the ARPA construction to do a report. I know the president has said several times that he would do that, and we still have yet to have them do a report. That's just because I want to know the process. Yeah, to the council. I want to know the process for the applications because I get conflicting stories every single time. So we just need the correct process for it.
That is ARPA, under budget, finance, didn't we? I don't know. Anyone got full? Yesterday we put.
Yeah.
Should we, give them a call and see if somebody can come down?
Yeah, we
Or you want to schedule another day?
I think if they have something in writing, also,
I think if they have something in writing, and also I think we should have a special meeting for it because I know that we all have 10,000 questions to ask.
Yeah.
And it's gonna take some time, and if we bring them down now, if they don't have paperwork, we don't have nothing in front of us.
Guys want to set a date? Anything for that?
Can we do it the Tuesday, maybe, I'm sorry, In October, when is our regular schedule in the second week in October? 11th and 12th. How about if we schedule 12th and 13th? How about if we schedule Lloyd and ARPA to come down on the 10th? If you guys want to meet on a Tuesday. Oh, it is?
And
But what about the 14th?
The 14th is budget and finance and enrollment.
We could schedule council
What
meeting.
about the 11th? What is the 11th? Transportation and TLE.
Okay, on the 11th, what, is there any travel on that day? There's a lot of travel yesterday, looks like.
I just figure the sooner the better we can get it. That way then the people can get their questions asked too or answered that day because I get a lot of them.
What about the 4th?
The 4th, we can do it in the morning, because economic development meets at 1. There's nothing in the morning.
But council supersedes any committee meetings, so.
You want to try the 4th?
Yeah.
You what is it?
Yeah, I just heard you crunch it or you push that. Martha, they're trying
Yeah.
to get back at you.
Empty out my bag.
I'll second her motion.
Okay. Jordan's motion, seconded by Pam.
I just have I have a comment, yeah. So how is this meeting getting scheduled gonna be different than any other meeting we've asked them to come and report to council?
I think that, well, like we said, we'd like to see something in writing in front of us, see what lists of houses they have. And Jordan, if you have people calling you, maybe you can get a list yourself and you can present it to them so that they can answer your questions on the people who are asking you about it. You know, like Martha and Fremont aren't getting responded to or whatever, and that way you can present it to them and they can ask for it too. But they do have a list of the contractors that go out and what houses they're working on. And when they go out and actually inspect these houses, then they have to go back and there's more things that need to be fixed. So it's just kind of, you know, so they have a report that they can develop for us to look at in person.
But actually getting them to show up though, because I know we've requested at least 3 times for them to report, so, and our chairman hasn't followed through with that, so then how do we get them to come actually show up, I guess is, how are we gonna do it this time, so they do come?
Well, I don't know, I guess Chairman, in my opinion, to kind of help with that, I think that they weren't given that direction, whether they heard it on the TV or not. But I think that if they don't want to come down here and address these questions, have something in writing for it, I think at that time, if there's no one here to address our questions and whatnot, I think we can just revamp that whole office. That is under the council, so I believe that we can do that.
Okay, thank you, Pam.
Jordan?
Just need to add to my motion to get a detailed report of the house repairs and who is on the waiting list for those repairs. And what the process is. That's what I'm requesting from them, I guess.
Motion, Jordan. Who seconded it? Pam seconded it.
I don't know if I want to accept the amendment. Just kidding.
Steve? All in favor? 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13. Opposed? 0. Not voting, 0. Tennille back on. Sorry, Tennille, I didn't know you came on. Were you voting?
Yes.
Okay. Thank you. 14-0-0.
I'd also like to make a motion to stop supplemental pay effective immediately due to President Biden declaring the pandemic over. I just don't agree with supplemental pay still getting paid. And I feel our tribal program should be open to the public. So that's my motion.
Jordan, we haven't been paying those. We talked through budget and finance, and they're gonna stop all the payments on those until as needed, so. Unless you know of a program that's getting it.
Yeah,
Which program?
they said ACF and PD are still getting them.
ACF and what?
PD.
PD? Well, they're still considered frontline, and they have BIA money, ARPA money, that they use to supplement that. It's not coming out of the ARPA money that the tribe received.
I understand that, but at the same time, I also feel that our programs could be utilizing that money in a different way instead of continuing to pay supplemental pays. I just feel like there's other needs within our programs that could have been getting met with that. So like more officers or tasers or their equipment, whatever they need, that could be utilized for that instead of supplemental pays. So I would just.
Your motion?
Yep.
Seconded by Chair, is there any discussion? Eileen, discuss. You bring your monkey wrench?
Yes, I did. Do I ever leave it home? Well, that supplemental pay, the pandemic isn't over. We're still seeing the numbers that we get on our, from Skyla, in our email. So people are still getting COVID. The cops are still picking up people with COVID, and they're going face to face with them. So they still are putting themselves in danger. So, you know, I'm for them getting that supplemental pay until we see zeros for a while. We did for a while, seen no COVIDs, but it came back and there was another strain, and a lot of people were getting that. A lot of people, from what the numbers are, they're not going in because they don't want to be that statistic and let anyone know. So the numbers are probably higher. So I'm for them getting that supplemental pay until we see no more COVIDs, because these individuals are putting their self out on the line for their job, their service. So we should pay them as such because they are doing a service to the people. You know, if we're going to call the cops on someone that roamed into your yard and doing something, then you want that cop there, and who's to say this person doesn't have COVID? So I'm for them still getting that pay.
The police are getting that. Does the ambulance service get that same? They're on the front line too, aren't they? Is there any more discussion? We have a motion on the floor with a second.
Is that Sherry that's second?
Maybe you read it back.
Motion by Jordan to stop supplemental pay effective immediately and to have all tribal programs be open to the public per the stop of the pandemic by President Biden. Okay.
Within, he got shut on that, didn't he? Saying it's over, and there's a lot of people said, health people said, no, it's not over. So he really got pounded on for that, the president. Go ahead, Jordan.
I guess I'm not in agreement with it's over, but what I'm agreeing with is we need to allow our people back into our programs and be servicing them. I agree that our police officers, they do have to come in contact with those people, but so does the rest of our tribal programs. So I guess that's why I'm doing this, is just it needs to be fair, and it's not. I mean, I know that they take an oath of office too, essentially, that they're going to protect and serve our people. So they, in a sense, they take that duty once they say those words and they wear that badge.
Sure.
I guess I just have a clarifying question. Is supplemental pay and hazard pay the same thing, or are they different? Does anybody?
Supplemental.
And hazard? We're no longer paying hazard pay,
No, that's
right?
not within the CARES plan. So supplemental will just be like the $3 increase on top of theirs.
Okay. All right. Just wanted to make that clear. Thank you.
there any further discussion? Call for the question.
We have a roll call vote.
Yes, good question. Mike. Question. Roll call vote.
Question?
Micah.
Jordan Ross,
Yes.
Russell Eaglebear is absent. Lisa Whitepipe,
No.
Steve Brave,
No.
Stanley Woodenai.
Oh.
Vanessa Red Hawk Thompson,
No.
Michael Lunderman,
Yeah.
Fremont Fallis,
No.
Tanil Blackfeather,
Yes.
Bill Marshall. Wayne Fredericks is absent. Eileen Schott.
No.
Martha Bluethunder.
No.
Sherry Wright Plank.
Yes.
Norman Running Senior.
Yeah.
Pamela Kilswater.
No.
Raymond Crow Eagle is absent. Dara Iat is absent. Donna Hollowhorn Bear is absent. Dwight Spotted is absent. Got 1, 2, 3, 4, 5 yes. 9 no. 6 absent.
Motion failed. Jordan, and then Sheriff.
So the first thing is can you get some clarification on the 1,500 for the people who didn't meet the deadline for the first ARPA payments? And then they reapplied, but they can't get the 1,500 that we just sent, or is there gonna be like a new application process, or is that gonna be an allowable thing later on, or have you guys discussed it in ARPA committee? So the first payments that people didn't meet the deadline for, they weren't allowed to get it, but they're asking if they would ever be allowed to get the 1,500 that we were just approved, or did you guys discuss it yet?
There were a box of applicants up there. I think there were like over 300 applications that weren't processed because they didn't meet the deadline, and we did authorize them to start processing those payments.
Okay.
So I don't know if when they started doing that, and then they've been overwhelmed from this $1,500 payment coming through, so.
Okay.
There are people that haven't been able to get the $1,500 payment because they didn't qualify for the $200 payment, but yet we're still working with the 18-year-olds, and the deadline for that we put is December 31st. So we're kind of working through those two as they come in.
Okay. And then the other one was the booster resolution. So not just for 50 and older, but have you guys discussed amending it to everybody, since everybody's allowed to?
We haven't yet, but like IHS, they only provide that booster for the elderly and the ones with underlying conditions. So once they open that up and bring in the booster is opened up to, like I say, people my age, we will open it up.
For everybody?
For everybody, but it just depends, like, you know, Melody said that they haven't received that booster yet for the other ones, so it's IHS that's doing the hold up. There have been some that came through from other healthcare facilities. I know somebody with my age that has underlying conditions did get a booster incentive because they had gotten their booster from Sioux Falls as part of their health prevention, so some of those go through. It just depends on if you have underlying conditions or whatnot, so.
Okay, thank you.
Lisa, that's all of your budget?
That is it. Oh, I'm sorry. I have one more. I was just given this by finance, and we have been doing, you know, we do have Dana Hanna employed as one of our attorneys for the ICWA cases in Pennington County. We did have some accounting of his bill payments, and he's been working diligently with Brenda Antoine.
How did that turn out, Lisa?
So we owe him a bill of $1,960 from FY 2021, which was last year. So I make a motion to pay Hannah Law Office in the amount of $1,960 and to be paid out of the old bill line item.
Lisa has moved. It's been seconded by Steve. Question by Pam. All in favor?
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12,
Tennille?
Yes.
13,
Opposed?
0,
Not voting.
1.
And that's it.
That's it. Thank you, Lisa.
Chairman,
Yes, Pam, and then Eileen?
We currently have an elder who's not doing well at our local hospital, more of just comfort. I was wondering if we can take a few minutes to say a prayer. He was a former council rep, he's currently the chairman of the Treaty Council.
Yes.
He's currently the chairman of the Treaty Council. He's really involved in education, especially with the language. And instead of, I think it'd be more appropriate for the tribe to recognize him and say a prayer for him while he is here rather than wait until he's gone. So I want to ask Keith to say a prayer.
Sure. Keith?
Ja, acho que aí a já eu planejo acho sabe que deixa eu para já me dá o tempo que eu tenho deixa each one da copy checar agora as acho quando já gente vila para chatting a gente acho vila tá outra solena outra vila tá outra outra we can't acho them eu fix eu a gente we chose on help acho já leram bem levou gente acho aqui ilana bom tá que a família né 가만 갔다 가기 전 가루 지금 차시 가루 조사는 하더라 지만 가면 지용시하고 그다음 그래 해지 고치지 조사하고 지적으로 내가
Oh.
Chairman, I want to thank Keith for saying that prayer. Sammy is actually my uncle, and kind of hard for me to ask for that on behalf of the family, but I really think that that encouragement needs to be there. Thank you.
Okay, that was all the budget and finance. Community residents have anything? Eileen?
I was just going to ask when enrollment's going to come up, because it's like 3 down, if we can call them ahead of time so that it takes a bit to get over here.
Okay.
Thank you.
Pam?
Yeah, Chairman, we had a slight discussion, but I think we need to go in depth in it. And I was just now looking at the agenda and I don't see TLE on our regular agenda. But I want to read this motion that was done at the TLE meeting on June 15th. Use the front door. No. Oh. On June 15th, the following action was taken during a regular TLE board Board of Directors meeting held on June 14th with a quorum of 5 members present. Motion made by Dira Ayat to approve the cost of cleanup of $93,385.48 for the Rosebud Fairgrounds and to deduct the amount from the Rosebud Sioux Tribes 2021 dividend payment. Second by Howard Valandra. The vote was 401. I think we need to address that under our budgets because they are a chartered entity of the tribe. And for them to dictate and take that from the tribe, even though they're under the tribe, doesn't make sense. But I guess I'd like to have discussion with council on it and see how they feel about it.
Okay.
That amount, are you gonna speak of- you wanna make copies for everyone? I think, how much was that amount? Was it 60?
93,385 and 48.
And it used to be that TLE dividend they would give us about $1 million, but it's been lower the past couple of years, around 900,000. But we budget that $1 million into our general account as revenue. So we haven't received one from Redco either for a while. But I think with them deducting that amount, and that's close to $100,000, but I think that's going to affect our general account. So.
Sure.
You know, as far as the dividend goes from TLE, I don't think that they should be deducting anything because that's our money. You know, they're making money off of the land. And I guess I have one concern. I know some of the communities get lease money directly from TLE as well. I'm not sure if that affects their ability to be able to do land purchases or not. But if they're having financial trouble over there, they should come here instead of trying to penalize the tribe. I don't agree with that, and I don't think that we should allow them to withhold any funding from our dividend. Thank you.
And then I guess, I think we would probably need our tribal attorney in here to help us with this motion. I don't know if we just make a motion to disregard this motion. What exactly do we do in a situation like this?
Okay, we get Eric if he's here. Sure.
Have we ever issued, have we ever penalized any of our charters financially?
No, the only thing that comes to mind is the old resolution that said we had to give the college a certain percentage of our leases. That never did happen. Goes back to the 70s. But in answer to your question, no, I'm not aware of any.
Okay, thank you.
Cleanup. Deducting from the dividend payment. Yes, Jordan.
Do you know if this is like for just the fairgrounds area, or is that like for housing? Or,
This was for the new electrical system up at the fairgrounds.
oh, okay.
And there were some other costs that were incurred to it was for electrical system and something else. Oh, to move that entryway from the rodeo grounds. Remember they moved it to the back, yeah.
It just says cleanup, so I was kind of confused.
So it says for Rosebud Fairgrounds. So that's what it was. And we were trying to get that done before the fair happened.
Okay, we're discussing. Anyone? Eric's here.
I guess, Eric, looking at this motion, them being the charter of the tribe, dude, and this originally started off as a council motion, and it was to have TLE pay for this. And then they counteract with this motion of taking it out of our dividend. Now, what is our recourse on this, as in, how do we fix this and still have them pay for it without taking it out of our dividend?
Just, good afternoon, council. Just having the motion or draft of the motion, not having any further information, I would ask them for a report and a justification as to, that amount. Was that amount agreed to already by council as the cost of the cleanup? Or did they make that determination? And also, on what basis do they justify taking the cleanup costs out of the tribe's dividend? I would ask for justification for that too, Chair.
Sure.
Yeah, that's it. You need more information, I would think, and what's their justification, basically? I'm not familiar with how they do their calculations for their dividends and when this dividend payment would be due, or how they reach that amount, and whether or not, on what basis they have the authority to deduct that amount without your consent. That would be the reason for the justification. So, and those are fair questions. I mean, the motion isn't very explanatory.
Thank you. My question is, does their charter and articles of incorporation and bylaws in the dividend section give them the authority to penalize a dividend? Okay.
It's not, I don't know if you call it a penalty, it might be an offset, but again, I'd like to know what their justification is, because they should be able to explain why they're deducting it, why there aren't any other funds for maintenance and cleanup, or whatever other funds they use as part of their lease revenue program. But they have some set aside to address these kinds of, not just clean up of this area, but any area that they manage. They're charged with managing tribal trust lands, right? So they have a fund for those kinds of costs that occur anywhere, not just at the fairgrounds. I would ask them for an explanation along those lines. I don't know how detailed they want to get in the motion. I would just ask them for a justification of the cleanup cost, and also an explanation as to what the reasoning is to deduct that from the tribe's dividend.
And then, this raises a question for me. And I know that a lot of people that probably just now listened and heard my motion and how I read it. We have Rosebud Sioux Tribal Chairman that's supposed to sit on that board. We have 3 council reps that sit on that board. Now, them as elected officials of the Rosebud Sioux Tribe took an oath to protect Rosebud Sioux Tribe. And yet, when you get a council representative making this motion and a council representative voting for this motion, to me, in my mind and the way I'm thinking, is that makes it seem as though they are going against their oath for the Rosebud Sioux Tribe. They sit on that board as representing Rosebud Sioux Tribe. So when this motion was made, it should have been an automatic defeat. nor should a council rep should have made this motion, because it was coming from this council during a council meeting that this be done. So I guess the question goes to, how does this affect a council rep's oath? Should there be a replacement done because they have not protected Rosebud Sioux tribe under their oath?
Well, Mr. Chair, that's kind of a different issue than the explanation for dividends. Now you're asking what their reason is for why a council person would make that motion. That's something that you could direct to that person before you make any. There's some inferences that you can make from that motion. There might be a reasonable explanation. I wouldn't know. But you can make that and ask that question. Council person, I think that's a fair question.
So Dira's not here, and we have the other two council reps here. So I guess I'll ask that question to the other council reps that are a part of this TLE board. What was the intent of supporting such a motion?
Board, do you have an answer?
No, we're gonna stay on there.
When this motion was made, I actually left because I had a court hearing that day. But it was just my understanding that one of the board members had said that they just weren't moving that week. So I don't know, then it wasn't brought up as an issue back over there again. I know Vanessa was there that day. I can't remember that day. I'm gonna have to ask Tony for a minute.
I guess I'm in a tough position. I took the same oath that everybody else did, which is to uphold our constitution and bylaws and to make sure that our tribe is protected. But when you have something like this happen, it kind of causes friction, I guess you could say.
Discontent.
Yep. And I don't like to go against my colleagues. I don't, because we all sit around and we have to work together in order to be better for our tribe. But when it's disheartening when you're put on a board to protect land, because that's all we have. That's all we have here is land. And you hear all the time people complain about cattle. You guys hear people complain about horses. You hear all these complaints. And yet this is just a cleanup of a fair to make sure that, things look properly up there. Put it back to the way it was. It's sad when you get motion like this coming from that board. So all I'm wondering is what am I supposed to do? Am I supposed to make motion here? What happens? I mean, we're always sit here and we always talk about we need to police ourselves. So what happens? I'm sure this isn't the first time something like this has ever happened, but it's probably always been behind closed doors discussion. But there's people that want to know because this motion is out there. It's out there. And I guess I just want to know, me, myself, what am I supposed to do? Does anybody have any kind of input on them types of things, or what do you guys suggest? Or are we going to just let it go and brush it under the rug again and keep going forward?
I guess if it was up to me, and it is, and I'm just the vice president 7 years, all I am. But I think I'd follow what Eric suggested. We ask them for the backup and the justification on why they made this motion, and then go from there once we have that. Jordan?
I guess, my input is council already made a motion and I feel like this is just a recommendation and our motion supersede this. So we directed them to do it, right? So I feel like that's where we have to stay with that because we supersede them. Just my opinion.
Sure.
Thank you. I just wanted to point out the letterhead on this motion excerpt. It says Tribal Land Enterprise, a subordinate organization of the tribe. So right then and there, it shows that TLE is our subordinate entity. And they do not have the authority to overrule the council. And if the council wants to dig in their funds in their bank account and get some of our money from our land and use it for our fair, for our people, we have the right to do that. And we put that board in place to help protect and manage TLE with good intentions. And I know that the board probably had good intentions trying to protect TLE, making this motion here. But I think a letter needs to be sent from the president's office, letting the TLE director and the board know that we're not going to allow this. And I think that this motion should be rescinded by the TLE board. Just my recommendation. Thank you.
Lisa?
I did find the correspondence where I did question why the fairground repair. Oh, and the other part of that repair was they paid for the conditioning of the arbor and the painting. So that was included in that too. Why that was taken out of our dividend, because I know sitting on budget finance, you know that's going to be that's budgeted into our general account every year. So I asked why it was decided that the Rosebud Fairground repairs were deducted from the dividend. Here's a response I got from a board member. The board needs to decide when to stop being the bottomless money pit for the tribe. We have been giving the tribe around $1 million a year, as well as mounts here and there, trash, etc. In 1943, the founding tribal council put in place a mechanism where the tribe places tribal land under TLE management in exchange for certificates. The bylaws state the board is in charge of TLE. The tribe can cash out certificates to meet their expenses just like other certificate holders. Every dollar not spent on buying land does not expand the tribe's land base or increase the income of TLE. So that was the response I had gotten. And I didn't know, I mean, if we could just go back and forth, and do we make a council motion and say, you know, when you give us our dividend, we also want this 93,000 back. Is it just going to go back and forth, or do we need to bring TLE in here and have a sit down and ask them why?
It's up to you. You know, the one thing I also wanted to mention on that 93,000 is the tribe is the largest shareholder, TLE.
Yeah.
So
we don't have the most certificates.
It's the tail doesn't wag the dog. It's the other way around. So if you want to have that motion and have them come over here and explain it, or just to direct them to rescind that, or it's up to you. I would ask them to provide some justification, and the other part of it is, how do they reach their dividends, and how do they determine what the shares are worth and how much the tribe's going to get as a dividend payment, and why it has to be deducted, and what authority they're deducting that from tribe shares, unless it's something that the tribe is consented to. I think they need to provide an explanation, a better explanation than bottomless pit thing, because those are all tribal assets and tribal resources. It's not their funds and their program and their assets. It's the tribe's land and the tribe's leasing grounds.
Pam.
Thank you. I guess I want to ask Jordan. She was a mover on a prior motion, but for October 10th is a regular scheduled TLE meeting. I want to know if you can move ARPA up to 1 or 2 o'clock, maybe 1 o'clock, and if we can meet with the TLE board here as a council on the 4th at 10 a.m. and get that done, and then go into our ARPA meeting, if that if we can amend that motion to have it that way.
PLE first?
Get TLE done at 10 a.m. and then go into ARPA right after. If that works. Thank you.
Okay, so till the 4th then, huh? All right. Okay. Chief President.
It'll be TLE at 10 a.m. and then ARPA following, right?
Yeah.
That's about right. Yeah. How about the AG?
And we got the AG scheduled that day too, right?
I'm gonna go pick up my son and I'll be.
You come right back. Oh, did you get my 2 resolutions done?
Yeah, I have one pretty much done. I was gonna bring him in after about.
Okay, so we're moving along. We're moving. Are we moving along now?
Okay, where's the meeting that you held at? Yeah.
Did we have any more for community presidents? We didn't have anything there, did we? Is there any economic development? I know they've been meeting.
There's 3 on the, 3 and 1 registered. The other one's registered.
Like I'm in a dark corner. Watch out. I need to smoke.
Did you used to smoke? Yes. Just connect. Huh?
Itancha?
Yes, ma'am.
Motion to approve, resolution 22-266.
Okay. Is that what she's handing out right now?
Oh. Shall I wait for, I'll wait for a minute.
Can we take a 5-minute break? Yeah.
You want to take a break?
Yeah.
You sure can.
Yeah.
4.5 minutes.
10 minutes.
Maybe 10 minutes and then it's like.
10 minute break, council.
Motion to approve resolution 266. 22-266, I'm sorry.
Okay, motion, by Cher, seconded by Pam.
Okay.
Got a number, so we'll read it in and then I'll call for the question.
Okay, sounds good.
Resolution 23.
Whereas the U.S. Department of Housing and Urban Development of Native American Programs is accepting applications for FY 2023 Indian Country Community Development Block Grant, ICDBG, CFDA number 14.862 for up to $2 million with an application deadline of October 24th, 2022. Whereas the Rosebud Sioux Tribe hereby certifies that the citizen participation requirements identified in 24 CFR 1003.604A notice PIH 2021-22 have been met for the ICDBG project that is being proposed. Rosebud Sioux Tribe Sichanga Resource Development Office held a public hearing on September 9th at the BIA conference room in Mission, South Dakota in order to meet tribal citizen participation requirements. 2 projects were presented under the public hearing, or at the public hearing under the project type economic development projects. The first one, RST Tourism, Cultural Arts and Welcome Center, the Old Red Log Building. This is a proposed renovation project to an existing building in the Rosebud community to allow for a cultural heritage, tourism, and economic development. The second one was SWA and RST IT Department, 1 Rosebud Ujiji Nawanji project, an economic development venture to construct a facility that would house an economic development project which focuses on capturing and compiling pertinent and relevant tribal data for all entities for the Rosebud Sioux Tribe, which will create jobs, training and jobs for low, moderate income individuals on the reservation. 2 community facility and improvement projects was presented via electronic submission. Parmalee Community Youth Center and Community Infrastructure Project, not yet identified. And whereas the Rosebud Sioux Tribe Sichanga Resource Development is seeking Tribal Council authorization to submit an application to HUD under Economic Development Project Type for $2 million with 25%, $500,000 leveraged resources by the Rosebud Sioux Tribe. And whereas RST Resource Development Office will work to develop an application that will meet required thresholds set forth by HUD for this specific project type. And whereas the Rosebud Sioux Tribe will maintain fiduciary responsibility and 20% administrative costs with the grant funds offer direct administrative oversight to ensure the project is complete in compliance with HUD requirements. And now therefore it be resolved, the Rosebud Sioux Tribal Council hereby authorizes Sichanga Resource Development to submit a proposal to the Department of Housing and Urban Development Indian Country Community Development Grant for Economic Development Project in the amount of $2 million with the Rosebud Sioux Tribe leveraging the required 25% grant match of $500,000 to be submitted by October 24th, 2022. And be it further resolved that the Rosebud Sioux Tribe here certifies that the citizen participation requirements identified in CFR 1003.604A and notice PIH 2021-22 have been met for the ICDBG project that is being proposed. Be it further resolved that the Rosebud Sioux Tribal Council hereby authorizes the tribal president or the official or the designated official to sign all pertinent applications, contracts, and documents thereof.
Any discussion? If not, we need a question.
Yeah. Ken is gonna.
Lisa, all in favor?
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12.
Tennille?
Yes.
13. Opposed? 0. Not voting? 1.
Thank you, council. And just to clarify, the match money will be provided by SRD. Mhm. Motion to approve resolution 22267.
We have a motion and a second.
Thank you. When the youth center was rescinded, the authorization for, the authorization for the, SRD to move forward with the 501c3 was also rescinded. So I'm bringing this forward, not with the youth center funds, but just to authorize them to start the 501c3. So I will start at 1, 2, 3, 4, 5. The sixth whereas Sioux Resource Development received a tribal council directive in 2016 to develop plans for a Sioux Lakota Youth Center to meet the needs of tribal youth, and whereas the Sioux Resource Development has worked to facilitate a tribal youth-led development plan in collaboration with existing tribal programs and entities whom possess the resources to provide a comprehensive service delivery plan to meet the most pressing needs of the youth residing in the Rosebud Reservation, and to provide opportunities for the youth to develop positive life skills, behaviors, and tools necessary for them to navigate and be successful in their roles as relatives, students, leaders, and community members. And whereas the construction of the youth center is necessary to improve youth access to essential services provided by key partners and stakeholders. And whereas the Sioux Youth Center will create a multitude of opportunities for youth to engage in recreational, educational, leadership, cultural revitalization, and social activities. And whereas the Rosebud Sioux Tribal Council has a vested interest in ensuring its youth possesses the means and resources necessary to achieve spiritual, mental, physical, emotional health, in addition to having opportunities to engage in meaningful development activities aimed at strengthening and empowering its youth to become leaders of their families, communities, schools, and nation, ensuring the survival of the Sioux language, or history, culture, language, and customs for coming generations. Whereas the Sioux Resource Development Team and its partners have concluded that the development and establishment of a 501c3 Sioux Youth Foundation is the ideal structure to seek out contributions from donors and ultimately provide financial resources to construct the Sioux Youth Center and fund youth programming over the years. And therefore it be resolved that the Sioux Resource Development will develop a 501c3 nonprofit foundation to facilitate fundraising efforts to ensure the completion of the Sioux Youth Complex in its entirety and future youth projects and activities. And therefore it be resolved that upon authorization of this resolution, Sioux Resource Development will immediately begin to develop a staffing and formal memoranda of agreements and understanding with key partners and stakeholders. And therefore it be resolved that the Rosebud Sioux Tribal Council approves and adopts the recommendation of the Tribal Economic Development Committee and authorizes Sioux Resource Development to develop the 501c3 Sioux Youth Foundation. And be it further resolved that the Rosebud Sioux Tribal Council hereby authorizes the tribal president or the designee official to sign and execute all applications and documents thereof.
Jeanette?
Yeah, Chairman, wasn't there a 501c3 that was done for the youth back when, like Brian and them were on council? Kathy and all them, remember they did a 501c3 because they were trying to do that big complex up there? And that's when they were going out looking at complexes and what to offer. I think during that time, somebody within there had done filed for a 501c3. Do you remember that?
It seems like you're right. I don't remember it fully though.
Yeah.
I can't tell you what year it was or anything like that. Jordan,
When I worked for the Sioux Youth Program, we didn't have one at that time because I remember I was trying to get one going then, so I don't recall us having one, at least for the Sioux Youth.
I think,
Well,
it wouldn't have been with your guys, with that program, it would have been, I don't know, Brian was on council then, Brian Dillon, and they were the ones that were working on that. And I'm pretty sure they had already created a 501c3 for that. Because back then they were trying to do that youth complex up on the hill. They were looking at acreages and stuff. So, I don't know.
any more discussion? Need a question? Jordan? All in favor?
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11.
Danielle?
Yes.
12.
Opposed?
0.
Not voting?
2. Is that it or there's one more?
Still, no, there's some more here. There's a 268 here. It says. It says. See you, Martha.
See you, Martha.
You should.
I have, Itancha, I have, two similar resolutions. The one that I read in that we, voted on, the 266, it came back. That's why I was kind of slow on reading it, because I was thinking that it looked different when we went over it on Tuesday. After they hosted the hearing, the only proposal that came through for the hearing was just the RST Tourism, Cultural Arts and Welcome Center. So this is the actual one that I should have read in and not this one that was there.
So you just put that language for the, cultural, or that IT department one? That, one she had taken out?
Yeah,
You just need that one taken out? So
Yep.
just amend your resolution to take out that.
to strike out 2, 3, and 4. The rest is all the same.
Community facilities, in it? 2, 3, and 4?
Yep. I read the wrong one.
At all.
Can you help me pay?
So, 2, 3, and 4?
Yep.
So two,
You have both resolutions, Madam Secretary?
motion to our amendment.
Yeah. So,
This is the correct.
Itancha, motion to amend Resolution 22-266
Right?
to strike.
We need a second.
Okay.
And question? Jordan, all in favor?
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11. Yeah.
Danielle?
12.
Opposed?
0.
Not voting?
1.
I wasn't there for this meeting, so was you there? If they have questions for this next one? I wasn't at this meeting for this next resolution that I'm going to bring on, so.
268.
Should strike out budget finance committee.
Okay.
And it comes short. Whereas, whereas, go Dev on there.
Just made it real wicked.
Hotel contract for the, employee. What is that do they bring on during?
During L&I,
What's that called? The employee seminar.
Employee Professional Conference, Professionalism Conference. Okay. Will it need to go to Budget and Finance? I know. Professional. Okay. Motion to approve Resolution 22-268.
Second. Question. Waive the reading.
Yes.
You don't want to discuss anything.
So you guys were moving yesterday.
You discussed enough in committees. Pam, are you questioning?
Yep.
All right, all in favor?
Wait, you gotta amend it and take out budget finance.
8, 9, 10, 11, 12.
As amended.
Danielle?
As amended.
Yes.
13,
Opposed?
0,
Not voting?
0.
All right.
I'll give the floor to Jordan.
For what?
You have those things from the committee?
Do we have one with no number?
No, that was the one that was the mistake.
Oh, okay.
Could we wanted to share something with the council, but it's regarding a personnel issue. Can we go off air for like 5 minutes?
Well, let me make the motion before that,
Okay.
before we go off there.
Go ahead, Jordan.
So through economic and development, there was motions made to advertise the positions and the companies under the broadband grant to follow their procurement. And then have SRD, Sarah Kilsenwater, oversee the grant until those positions are filled, and then also create the job descriptions for those positions.